Um,
Good afternoon, everybody. You could all take your seats.
We're not jumping yet.
I know. You're all set, Madam Administrator?
Yes.
No, Taylor says no. Taylor, are you all set too? Okay, good. So we're gonna convene the Appropriations Committee public hearing on block grant allocation plans for review, and they are the FFY 25 maternal and health services block grant, the FFY 25 preventative health and health services block grant, the FFY substance use prevention, treatment and recovery service block grant, the FFY community mental health services block grant, the FFY 25 social services block grant. And we have with us today the following committees. We have Public Health, Human Services, and Appropriations. Representative Walker, do you have anything to say?
No, ma'am.
Senator Berthel? Representative Nuccio? Senator Lesser?
Glad to see you in one piece, Madam Chair. Good to be with you.
Yep, I made it down from skydiving. I'm so excited. Representative Gilchrist?
Just happy to be here. Thank you.
Senator Seminara?
Good afternoon, everyone. Thank you so much.
Representative Case?
Good afternoon, Madam Chair. Looking forward to a good, robust conversation.
And per your conversation last meeting we had, I didn't have to have anybody push me out. I went out myself. Senator Anwar?
I lost my chance.
Thank you, Madam Chair. Great to see DPH, DMS, DCF, and DSS in the room. Thank you.
Representative McCarthy? Fahey?
Thank you very much, Madam Chair. Looking forward to the discussion today.
Senator Summers? And Representative Claritas Detria?
Thank you, Madam Chair. Looking forward to a great discussion today.
All righty. So that's everybody in the room on the legislative side. And now we're going to go to the members of the public. Commissioner Gittani, you are up first.
Thank you very much. Just to start, I wanted to find out which of the block grants you wanted me to start with. Do you have a preference? I have two block grants, the preventative
No,
health.
we don't care.
Doesn't matter? Okay.
No, we're not asking questions until you're all done with all of your testimony. So
Shall I testify about both
yes.
at once? Okay.
Yes.
Thank you. So thank you very much to the distinguished members of the Appropriations and Public Health Committees and other committees that are here as well. And thank you for this opportunity to present on the department's federal fiscal year 2025 allocation plans for both block grants. I will start with the Preventative Health and Health Services Block Grant. This block grant was established in Congress in 1981. And this provides funding to address each state's unique public health needs and innovative local health driven ways. And so these funds have been used to support state and local efforts around asthma, cancer, cardiovascular disease, diabetes, smoking cessation, injury prevention, suicide prevention, and rape crisis programs over the years. And so this particular year, we are continuing with those efforts. We did receive a one-time increase in funding for fiscal year 2024 because of the way the budget cycle at the federal level has operated. We did not budget for that last year. And so we've put forward a budget plan this year that incorporates how we are spending those funds in addition to how we are spending fiscal year 2025. But in FY25, we do expect that the base level will be back to what we are expecting. And, just as a reminder, we basically send 46% of this funding out to local health departments. There are 18 different departments or districts that were awarded these grants through an RFP process, and they will continue to receive these funds over the next 4 years. There is also, just as a reminder, a mandated sex offense set aside within this particular block grant. In terms of the Maternal and Child Health Services Block Grant, this is administered by the Maternal and Child Health Bureau, which is within the Health Resources and Services Administration, or HRSA. And the department is the designated principal state agency for the allocation and administration of maternal child health services within the state of Connecticut. And we use these funds to promote the development of services and systems within the state to promote reducing infant mortality, providing and ensuring access to comprehensive care for women, promoting the health of children by providing preventative and primary care services, increasing the number of children who receive health assessments and treatment services, and providing family-centered, community-based coordinated services for children and youth with special health care needs. One thing that I want to alert you here in terms of changes this year that are different than prior years, the Family Wellness Healthy Start Grant, which is a grant that DPH used to receive, this grant used to fund services in Hartford and New Britain. And that grant was not awarded to DPH going forward. There is another Family Wellness Healthy Start program that funds work in New Haven directly. New Haven is the direct recipient of that fund. So that is continuing. But because the state is not receiving Family Wellness Healthy Start funds, we are putting part of our funding from the block grant to continue certain services in federally qualified health centers in specifically the areas of Hartford and New Britain so that we can continue with enhanced case management, augmented case management in those particular 2 municipalities that will be losing funding for this particular grant. So that is one of the major changes in terms of our funding for this particular allocation plan. And that summarizes my testimony on these 2 block grants, and I'm open to questions.
Does anybody have any questions? Representative Walker?
That we moved down. Oh,
I-
thank you. Thank you very much, and thank you for your testimony. I just have a question on the preventive health and health services block grant. I noticed there was a reduction for the local health departments. Can you, can you explain?
So the reason for that is that asthma prevention used to be something that we used to incorporate within local health department contracts. And what we found is that the program called Putting on Airs was not as well, there wasn't as much uptake in the community when administered by local health departments versus healthcare providers and institutions that were really interfacing with the community more at the provider level. So we have shifted that particular funding around asthma prevention specifically, and that same Putting on Airs program, more to providers who are more in direct contact with patients who have asthma. And we've found that, and in fact, many of the local health departments actually agreed that they were having a harder time actually implementing some of those programs from a prevention standpoint. So that's why it's really not taking money away from asthma prevention efforts. It's more shifting where the funding is going to making sure it's getting in places where people will actually use it most.
Okay, I like that. I like that because we all know asthma is real. It's got an uptick right now, especially with younger kids. And it's kind of a phenomenon that we have to look at. And I guess you were also mentioning doing funding for the FQHCs. Can you restate that? I didn't quite hear that.
Sure. So there's a specific grant called Family Wellness Healthy Start. It is a grant that originally was actually funded in New Haven only. And then the state was able to apply for this grant, and we had noticed a specific need in Hartford and New Britain. Now, the CDC had a reimagining of who they wanted to fund for this particular program and how they wanted it funded. And so actually many programs were stopped receiving additional funding for Family Wellness Healthy Start. That particular program really provided augmented case management for women, for people, birthing people during the pregnancy, after the pregnancy. And so what we really wanted to be able to do, since we're not receiving that funding anymore, and we know that Hartford and New Britain were areas where birthing people have had specific challenges and we didn't want to lose the augmented case management that we could provide, we shifted $55,000 to be able to help support that type of work through our federally qualified health centers, where we know at least we're not going to be able to continue providing it everywhere, but we wanted to make sure we continued providing it there. And so that's why that shift in funding has occurred, to ensure that we could continue to provide that needed service in those communities.
That's so little money for something that, hello. Yeah.
Who turned our lights on?
Lights are
Who
gone.
turned the lights up?
Are you
So,
all set?
so I just want to thank you for doing it. I hope we can look at some other areas to add to that, because I think that's really critical. Thank you. Thank you very much, Madam Chair.
Thank you. Senator Gordon, followed by Representative Nuccio, followed by Senator Onwar.
Thank you, Madam Chair. I just have one question at this time. Commissioner, thank you for being here. And being a cancer doctor myself, I always look to see what's going on for cancer prevention, since, as we know, that's the best way to deal with cancer as opposed to when it happens. But I just want to make sure I'm understanding. I understand that you had testified that there was some one-time funding that came in, and there's this pilot program relative to early onset breast cancer survivors, which is certainly very much needed, especially as we're seeing more and more people, unfortunately, in this state get diagnosed with breast cancer. How long is this pilot program going on for? And if this is something that is successful, which I hope so, is it something then you're going to be asking for additional money from the state and or the feds?
Yeah, so thank you for that question. So, we have a great group of DPH staff who are here who really thought of this idea and recognized it as an area within our cancer prevention program that was lacking and that we didn't have something on. So because we got this one-time funding, they had this idea and had the concepts of what a pilot could look like, and decided to fund this pilot with this one-time funding through a partnership with Hartford Healthcare that we are doing. Now, in terms of the longevity of that project and where we'd be able to go from there, we may have to apply for additional funds. There are other opportunities through the federal government to potentially apply for additional sustainability funds. And if we get some success with this pilot and get it off the ground, we will have more preliminary data to be able to then provide that information we need to potentially sustain that work going forward.
Thank you. And I certainly hope very much it is successful and we can keep on doing it, because it's something that's very much needed and will continue to be needed, as you know, in the years out, just not in this state, but the whole country. So thank you for doing the pilot program.
Thank you.
Representative Nuccio.
Thank you, Madam Chair. I have questions on both of the grants, so I don't know if you want me to just do one and then come back. You're coming back then. Okay. All right, I'm gonna start out with the preventative health. On the preventative health block grant here, as I'm looking at this, I'm trying to figure out in the actual allocation, the PDF allocation, I was talking about the major uses of funds. And one of the things that came to my attention is rodent control and fluoridation programs. Connecticut does not use funds for either of these services. And then looking through the detail and the backup on here for the asthma, we were talking specifically about asthma prevention, right? One of the key causes there, of course, would be rodent control, insects, mites, stuff like that. And it caught my attention that you served 35 participants in the asthma prevention program. And at the tune of, $100,000, that, first of all, 35 people at $100,000, I really want to understand how that money is being utilized. But it says a third of the families are exposed to insect infestation. And 19% of the families in the assessment revealed exposure to rodents and pets and poor indoor quality ventilation. After the third home visit, it says still 40 to 50%. I mean, that would be 60% of people still have increased exposure to pets and rodents. So I'm wondering if you can tell me why Connecticut is not using funds for rodent and fluoridation, especially the rodent control, when we know it's a contributor to asthma, and we're seeing that directly in the report that you guys provided.
Yes, thank you for that question. So this particular block grant is not being used at this time for that reason. But historically, there may have been other times when it was used for that reason. I will ask if people who at DPH who've worked here in the past may have looked at some of this. What I do know in working with our local health departments is it does not mean that these issues are not being addressed. It's just that this particular block grant may not be where they are using dollars that we are giving them to be able to address those issues. So I know, for example, having been to one of our city health departments, they use different funding to be able to address those issues at the municipal level. Our block grant, we've given out 18 different block grants to address that issue, to address public health issues more broadly through different health departments and districts. Now, to your point on asthma prevention, there are a lot of different interventions that potentially could be used for asthma. And this Putting on Airs program, that particular program, one of the reasons that we've moved it to providers is because that's where we were getting the biggest uptake of interaction and people who actually utilized the program. When it was in the local health department, it wasn't being used as much. And one of the things that they really do through that program is identify what may be the triggers for that particular asthmatic patient. So the child who's coming into that program and is being evaluated by that Putting on Airs program, they sometimes do home assessments. They do other assessments of what's going on and what may be the exact trigger in that situation. And our goal is exactly what you're saying, to increase the numbers, have the program actually have the breadth and impact that it should, as opposed to housing a program in a local health department where it may not have as much uptake. So I'm just going to turn to my group to see if anybody has other information on historically the issue on rodent control and fluoridation. Do you know anything else about that? Can anybody else here? Okay, so it looks like we don't have additional information in the group beyond me who, may have been here for many years, but I do know, for one thing I can say, is that a lot of that type of work at the municipal level, some of it may be in the health department, some of it might be in other areas of departments within local municipal government. It may not be in the health department. So part of the reason, like rodent control as an example, part of the reason that we've tried to do this is target funds where our health departments can utilize them in the best way, because they actually have the levers within their department. If the health department doesn't have that lever at the municipal level, it makes it harder for them to do that.
Thank you. So I get the whole moving it from the health departments to the doctors, because again, they're the ones who are seeing the kids. It's direct access. I understand that. I guess my concern though is without seeing where we're actually spending money to reduce the rodent and insect infestation in these homes, I'm concerned. Again, like it's $97,000. We're only servicing 35 people with that. That is a steep price tag. To know that we're not addressing one of the main issues specifically with this money, or not knowing where that money is coming from, or if it is being addressed, when all of the efforts in this program show, again, like to 60% did not have any impact, right? Only 40% reduced exposure to this kind of thing. It's just concerning, right? As a mom who had kids and asthma, understanding that, I just think that I'd like to see some more information on where we're actually addressing the rodent control, the insect infestation, especially in the city areas, the places where we know, we've had legislation last year talking about rodent infestation. I would like to understand where the money's being spent and what we're doing with it. For my second question, I think you already said this, but I'd just like to confirm that the health departments are aware of this shift. They know that they're going to be receiving less money. So they're aware.
Yes, because it was an entire RFP process where they had to submit proposals. Nobody submitted proposals for asthma because they already knew that we were making this type of shift.
All right, so they're aware.
Yes.
Okay, and I will come back for my second question.
Senator Anwar.
Thank you, Madam Chair. Thank you, Commissioner, for being here and the work that you and everybody in the department does. I just wanted to make sure that we put this on the broader perspective that this is just part of the block grant, but the DPH budget includes number of these issues, and that's part of the priority. Because if I was to just look at the block grant and see there's a 77% reduction in cancer prevention, as Senator Gordon had suggested, that would cause a little bit of a panic. But the reality is that the DPH budget is addressing some of those things. This is part of the block grant. I just wanted to clarify that, and some of the other things, nutrition and so on.
Thank you, Senator Anwar, for that question and clarification, because you're absolutely right. As you know, we are an 80% federally funded agency, and we receive multiple different grants on both all of these preventative health considerations that we're talking about and maternal child health. So we have multiple other grants that do cover those other topic areas as well.
And the second part around the same issue is that we are looking at these grants now, and we set the budget for 2025 before. And is there a way to be able to address preemptively some of the shortfalls that we may anticipate in some of the areas that the federal block grants are going to miss or not give us the same support that they have been?
It is a real challenge for us because, as you know, for example, this preventative health and health services block grant in the federal House budget is zeroed out. It's completely zeroed out. So if that were to pass, the Senate budget does not show that. But if that were to pass, we would have a challenge on our hands. So all our contracts and granting is based on available funds and what is available to us from the federal government. But at this point, we are hoping that we at least get flat funding, which is what we are planning for and budgeting for. And we'll have to make adjustments based on what happens over the course of the next several months.
Thank you, Commissioner. Thank you, Madam Chair.
Thank you. Up next, Representative Nolan.
Thank you, Madam Chair. Good afternoon, everyone. Commissioner, I just wanted to talk about that AIRS program once again. So it's not going to be going to the community health centers. It's going to be going to the provider. Can you explain how was it marketed? Because it just seems like 35 families is just not a lot. And I know back in 2020, maybe 2020, before we started going through COVID stuff, that was a conversation in New London. And I'm just wondering how it was put out there for families to find out about it, because I do remember that there weren't many people that were taking part in it. So how will the provider be sharing the information to let people know that these in-home assessments are available?
So thank you, Representative Nolan. So first of all, just to clarify, it's not that it's being removed from community health centers. It's being removed from local health departments.
Okay.
Local public health departments. We are not, those that were funded to receive funding to conduct the Putting on AIRS program will not be receiving that funding. There are a variety of types of healthcare, more forward-facing facilities where this program will continue. It is emergency room visits and referrals that is our primary way of trying to get people connected. But we also are trying to make sure that healthcare providers are well aware of this program, make sure that the information is out there so they can make the relevant referrals to the places where people can go. And I think what we're hoping is that putting it in areas where asthma rates are higher and where providers who are seeing children with a high number of asthma admissions or referrals to the emergency department will make that referral network even better.
All set, Representative Nolan?
One more question. Is it possible for us to get a list of places that will be taking on the work in regards to the AIRS program? And also if we can get any kind of flyer or information so that we can also share it for the families that we know might benefit from it, please?
Absolutely.
Thank you.
We will do that. We will follow up with that information. Thank you.
Thank you, Madam Chair, and thank you, Commissioner, and everyone for being.
Representative Johnson.
Thank you, Madam Chair, and thank you, Commissioner, for your work and your presentation. Just a quick question on the perinatal case management reduction. Even though it looks like it was the same as your actual expenditures, I just wondered, are you monitoring what's going on with perinatal healthcare, and how would you give us data on that?
So that is a core part of what we try to support and espouse as a department, and funding a variety of different groups that help in this process. And as I said, because we lost one grant in that area, we're trying to supplement it with partly funding from this block grant, but we can also provide additional feedback and information after that. We can follow up with you on information around perinatal case management, if that would be helpful.
That would be extremely helpful. I really would appreciate that very much, especially given my circumstances here in Wyndham. Thank you so much.
Thank you.
Representative Dathan.
Thank you very much, Madam Chair, and thank you, Commissioner, for being here today. One of the things in this block grant that you talked about was suicide prevention, and I was hoping you could elaborate on, outside of this block grant and in this block grant, what does DPH do for our local health authorities to provide support in that, and also what sort of prevention are you helping with in the community for youth?
Absolutely. So thank you for that question. It's a very critical question right now, especially. And a few things that I would mention. First of all, one of the things that DPH gets funded to do a lot is collect data and generate reports of data. And one of the things we do is we actually have a monthly report that is sent out to municipalities so that they can see numbers of all types of violence, but including suicide within their local community, and to have a sense of that. So that's one way that we help out local communities. The second way is we do partner with some of the other sister agencies that are here in the room today, between DCF, DEMIS, DSS. We have a variety of suicide prevention grants, particularly with DCF and DEMIS, that we cooperate with them on. And we have a variety of campaigns that we help support, again, especially with Suicide Prevention Month, right now ongoing in September, and help bring those communications, the funding that we receive from the CDC, to be able to help enhance those efforts. We also help support the United Way in their 211-988, again, with funding in part that comes from us, more supported from some of our partners, but some funding from us as well. And then the last way that I think is not necessarily so much part of the grants that are here today, but I think people should be aware of, is our school-based health centers. And our school-based health centers, in my mind, is one of the greatest ways we reach a number of children. Now, again, not all children, but our school-based health centers got additional funding, both through ARPA dollars and CDC funds over these last several years, where we were able to expand mental health services to certain centers that had no mental health services, and then create new mental health centers at school-based health centers. And sometimes children may come in complaining of a headache, stomach ache, other physical ailments. Maybe they're coming in for vaccinations. Maybe they're coming in for an exam, routine physical exam, but they do screening for questions around anxiety, depression, suicide. And I think that that is, again, a big opportunity to capture children right when they're being assessed in real time. And so I think that's one of the things I'm very proud for, all the DPH staff that's here and that have worked towards really enhancing that school-based health center network that really is a real opportunity to catch children where they're at in real time.
Thank you so much. If you could have your team share this information, an example of this report that you're sharing with local health centers, as well as some of the other resources you talked about, that would be great. We had a youth suicide over the weekend in my community.
I'm so sorry.
We need to make sure that folks know about these services, and we are doing everything we can as a state to prevent these going forward, because this is just tragic. So thank you so much. Thank you, Madam Administrator. Thank
Absolutely.
you, Madam Chair.
And I would just follow up. First of all, I'm so sorry for your loss and for your community. And, the governor hosted a forum a few weeks ago on suicide prevention in our youth. And I think one of the greatest challenges is that we try to share resources, but until it's in your backyard and your problem, sometimes people don't think about it. And honestly, asking young people about suicide is our greatest way to be able to open the door for them to know that it's something okay to talk about.
Absolutely. And that's why I think it's important for us as legislators to make sure that our relative towns and communities know about these resources so we can prevent this useless tragedy going forward. So thank you for all your work, and I really commend the governor for highlighting this in his recent program. Thank you very much. Thank you, Madam Chair.
Representative Porter.
Thank you, Madam Chair, and thank you for being here today. Just a couple of questions. I'm looking over the grant allocation, and it's talking about the objective to provide case management services for pregnant and parenting women to promote healthy birth outcomes. And, we've done a lot of work around Black maternal health. And two of the questions that come to mind, there's several questions, but I'm going to stick to two. And you're welcome. The first thing, all right, thanks. The first thing, well, I don't even know where to start, but I'll start with this. How are we ensuring accountability with hospitals and providers to reduce the racial disparities in maternal care and maternal health? How is this funding addressing that, if at all?
This funding is just one piece of a larger
Yeah.
set of policies that the department is working towards. And as you know, this is something we've worked on together and will continue to work on in terms of maternal health, and particularly how it's impacting in a disproportionate way our Black and Brown communities. One of the things I would say is that what has become very evident to me, reviewing data, looking at what's happened in our state pre-pandemic, during the pandemic, and how things are continuing to evolve, is we know we've had a substance use crisis in our state. And that has affected everybody, including birthing people. And one of the things that we need to do is ensure that facilities, healthcare institutions are making sure that they connect patients who are pregnant, birthing, to the necessary resources and care that they need postpartum, so that what often has taken the life of a new parent, whether it's related to substance use or related to mental health issues in that postpartum period, we really need to make sure we connect people. And although not part of this block grant, I think just highlighting again the Universal Nurse Home Visiting Program that is off and running in Bridgeport and opening in other areas of the state in pilots, and that the legislature helped fund and support in these last few sessions, we're giving people that opportunity in that time period right after birth to have a visit from a nurse, to have community health workers potentially come into the home and help make sure that those connections are in place so that people know what they need and have the resources available to them to help keep them on track and hopefully not end up a statistic. And so that's why I say that this is just one piece. The block grant only funds a part of it, but there's a lot of work that DPH does in this arena to help make sure we address the issue that you're talking about.
Yes, and I thank you all for the work that you do. It is so critically important, and I'm glad that you mentioned community health workers, because I'm hoping that we're going to see an increase there, because that's so needed, especially in the communities that we're talking about that are disproportionately impacted by maternal mortality and infant mortality. The other thing that I wanted to talk about, how are we addressing the social determinants of health, specifically when we're talking about communities of color? And you touched on it a little bit in what you said just now, right? All the different things, the housing and food food deserts. I call it food apartheid. I think it's quite intentional the way our communities are designed, what we have access to and what we don't. Plenty corner stores and liquor stores, but no Whole Foods, no healthy fruits, the things that are conducive to good health, right? Lots of sugar and fructose. We have complete access to that stuff. So what are we doing in the way of helping to educate and elevate people in that manner?
So, you bring up a great point, because part of health and sustaining health in that time period is so related to these social determinants of health and the underlying infrastructure in terms of helping somebody move forward. And that's where it really becomes an all of government approach, because One of the things we've also found is that, particularly when you think about maternal mortality, if you look at instances where maybe somebody has died, sometimes there are resources available, let's say through DSS, that maybe somebody didn't know about or didn't get connected when they had that contact with the healthcare system. So that a program may exist. And that's why, again, something like the Universal Nurse Home Visiting Program, the idea of universal is everybody gets the opportunity for that call. Everybody gets the opportunity to have somebody come into the home. And we want to reduce any sort of stigma or barriers that may be there. And we want people to be able to understand that this is an opportunity to connect. And so particularly when I talk about DSS, there are so many programs that do help with some of the things that you're talking about that can help with some of those social determinants. But if somebody doesn't know about them or they didn't get connected at a moment when all of a sudden maybe they were eligible for something, maybe they weren't eligible before, but now they are, they're newly eligible. Making sure that we enlist our healthcare providers and the healthcare systems to ensure that those connections are happening when that person is captive and is actually a patient in the system is a way that we can help make sure that all of the resources that are available at the government level actually are making it to the people who need it most.
Yes, and I think you're spot on with that. And the other piece to that would be the cultural competence, because I think a lot of times that information is not being shared because these lives and these people are not valued. And on top of that, there's just a cultural competent gap, right? Where people don't get it. It's not your lived experience. So I think it's important that we are building into the program, the overarching program, components that address the root causes. Because until we pluck it from the root, we will continue to deal with the issues. So thank you again, you and your team, for the wonderful job that you're doing. And I appreciate all the hard work specifically around Black maternal health care. Thank you, Madam Chair.
Do you want me to add you on to the list for a second time? What'd she say?
She said, sure.
Okay. Representative McCarty.
Thank you very much, Madam Chair, and welcome, Commissioner and your team. And first, let me just thank you for the very detailed explanation and summaries of the various programs. Very important to remind us of what we're doing. But my question concerns itself with the appropriations and with the allocation plan itself. So you mentioned that a lot of this is contingent on where we go with receiving federal funding. Can you just describe briefly, perhaps the process that you would use if you don't receive what is anticipated with flat level funding? What process is in place and how do you decide where those cuts might go?
Well, first and foremost, I genuinely hope, and it seems that that won't happen and that we can hopefully count on at least flat funding here. But one of the things, because we are an agency that is so dependent on federal funding, is we are constantly assessing programs, staff, where there may be shortfalls, where more money may come in, and how can we do a patchwork of braided funding sources to ensure that we don't lose programs that impact the lives of people in our communities. So our approach is really one to identify the programs that are working the best, that are being utilized the most, identifying the communities and areas that are of the greatest need, and then trying to use whatever funding sources we do have to be able to reallocate, if appropriate, within whatever the grant may be, to be able to help ensure we continue as many programs as possible. And as I said, with the Family Wellness Healthy Start program, as an example, when we lose federal funding, sometimes we have to make tough choices. And, sometimes there are certain programs that we just don't have the funding to continue because funding has been pulled. But when that happens, we identify where can we utilize the dollars that we have best to make sure that the programs that are going to impact the people who need it most can continue.
May I just follow up with that? It's in the same question, but you answered most of it, the question, and I appreciate that. But I was really looking to see, do you have an advisory committee in place, the executive committee? Who makes those determinations?
So basically, in any, and this is true of all work that happens within DPH, when our program staff identify that there may be an upcoming shortfall like that, for example, they get notification from one of the federal agencies that funding is either going to be less or is going to be more, or, whatever it may be. It then goes through our department management to be able to go to managers and then ultimately through to the executive team at DPH, who will evaluate and review what the impacts of those decisions may be, and ultimately then come to a decision, that I'm involved with as part of that, executive team, basically my executive team, who would be getting all of that presented to us.
Thank you very much.
Is there anybody else for the first time around? So I have one before we go to the second time. We talk about breast cancer rising in the state of Connecticut, but what is that compared to? Because my understanding is that there are certain states that don't require, as a part of their insurances, for scans to be paid for. And so if those scans aren't paid for, people may not necessarily even know that they have breast cancer. By us requiring that at an earlier stage, we are able to identify and treat. Oftentimes in other states, when it is identified and there is a treatment, it is at a later stage. So how many other states don't require scans by their insurance companies?
I would have to get back to you in terms of a comparison in terms of which states do not provide that. But I think what you've said is exactly right. Our goal in public health and in prevention in general is trying to catch disease early so that you can screen and treat early, versus what you're describing is people are presenting at later stages of disease and then end up needing more extensive surgery, sometimes more extensive treatments. So in terms of our comparison,
treatment.
I'm sorry, say it again.
Or it may be too late.
And sometimes it's too late. That's right.
So I think sometimes when we make comparisons and we make statements that say Connecticut is seeing an increase in breast cancer, and I have many friends who have experienced breast cancer, but if we're not requiring those scans, then we're not necessarily finding out early enough, and we may not find out at all. So I hate making those comparisons and saying Connecticut's at the top of the list for breast cancer. It may be just as a result of the testing being done.
So I think you're, first of all, absolutely correct. If you don't go looking for it, you won't see it. And you may only find out about it when it's too late. And so some of it certainly is the fact that we're actually screening and looking for cancer because we're trying to ensure that people have good outcomes, which we also have in Connecticut. Although we have higher rates, we also have better outcomes of people who've been identified as having had breast cancer. I think that gets to your point, which is that if you identify it early and you can do the treatments early, then the chances that you're going to have better outcomes are also more likely. So we can look into whether we have those comparisons to other states that are not funding that. But I think it's a very important thing we're doing in Connecticut to try to ensure that early treatment and prevention.
But I also think the narrative that cancer is more prevalent, breast cancer in particular in Connecticut, is not the real narrative. The real narrative is the outcomes.
Correct.
And I think that that's something that we have to strike that balance with, because narratives can be skewed in so many different ways. And I want to make sure that people, particularly the audience, doesn't hear, oh, Connecticut's got this huge increase of breast cancer and, oh my God, it must be because of the environment. It must be because of this. It must be because of that. But it's none of those things. It's because we do a better job of screening to begin with. And I just sometimes think that our narratives are pointing us in, we must be the worst state on this. We must be the worst state on that, when we're not. So I just wanted to at least make that clear, or at least have an understanding on my point of view on that. So thank you. Representative Nuccio?
Before I ask my question, Madam Chair, can I ask you a clarifying question? Do you mean that scans are not covered because scans, breast cancer, mammograms are mandated by the ACA. So insurance
Okay.
companies at the age of 40, every woman has the opportunity to get one. Is that, do you mean like they're not
If
covered?
those states have taken on the ACA, which is, some states have not complied with scans. Their insurance companies may not be covering those scans, but we have made it an affirmative part of our healthcare. And I know states that don't necessarily cover scans. So I just want to make sure that we're looking at this and not seeing that Connecticut has an increase in breast cancer because of another reason. That Connecticut must be this place that has an unrealistically high percentage of breast cancer.
I guess I'm just more confused because we can sit down and chat about it because the ACA, the federal ACA guidelines are not like, they're federal guidelines for all carriers. So the essential health benefits are like, insurance companies have to allow for those. So we can sit down and chat about
I
it.
think we should talk about it because
Yeah.
I don't, so she's laughing at us having this discussion.
No, it's okay. I'm just, we can sit down and talk about it because I know the essential health benefits, that part of the ACA hasn't been repealed. So the part of the health benefits.
Thank goodness.
Well, exactly. Well, the essential health benefits are
Right.
mandated. So, all right. Anyway, and that's not my question for you. My question for you, my second set of questions here is around the maternal and child health block grant. And I have a couple of questions in here. First of all, this is a topic that I've been very interested in for a long time, and I've been trying to work actually with Representative Porter, who's no longer here, especially looking at the maternal mortality rates and the infant death rates, especially of women of color, and what's impacting that and how we can make it better. So I'm wondering, looking at your paperwork here, it says we're talking about reducing infant mortality, providing and ensuring access to comprehensive health care. Where do we see what you're doing? Because as far as I last heard, our rates haven't gotten better. I believe they've actually gotten a little worse when it comes to mortality rates, maternal mortality, especially for women of color, and infant mortality, especially for babies of color. And I would like to very, very clearly and openly make a direct link to the fact that we are seeing our hospitals close maternity wards in rural parts of the state, all over the place. A birthing center is not going to help, right? So I see this and I get a little agitated because I know our numbers are going up, and then I see the dollars and I'm wondering what exactly is happening and why our numbers are getting worse. So tell me why I think any of this is the right thing.
So this particular block grant is just one grant from a department of a multitude of grants that are trying to address the issues around maternal health and particularly Black maternal health. So what you see here is only one piece of that. One of the things I would say is we have another funding source that helps support our maternal mortality review committee, which is the committee that reviews those deaths that you're describing. Between 2015 and 2020, there were on average 5 maternal deaths a year. And in 2020 to 21, you're right, it went up a little bit, more around 7. Okay. And I think we still have more work to do to get a better sense of these next several years, what it's going to be like. One of the reasons I was talking before about ensuring that there's follow-up in that period right after people leave the hospital, leaning into substance use, mental health, intimate partner violence. These are areas that in our review of maternal mortality review reports, which we have a grant and a group that does that within DPH, those are some of the areas that we're identifying are where the gaps have happened when there is a death in the time period, let's say in that year post-delivery. And so that's why I lean into the fact that there are things that can be done, because it's not just what DPH or the state is going to do. It's obviously a multifactorial system that is working together, from providers to healthcare systems to policy, as you know, the entire sphere of influence that multiple people can have. And so you're right. If you look at this one block grant, you would say, well, this isn't enough to deal with the problem. And you're right. You're absolutely right. This one block grant is not enough to deal with that problem. But that's where we have to really lean into are the other grants that we have, other partnerships that we have, and other partners that we have through state government. Because as I was mentioning, when there are resources available in other parts of state government, you want to make sure that that person has access to them, whether it be things related to mental health or substance use or intimate partner violence or whatever it may be, where we find some of the bigger triggers to be. And so that's what I would say is that, you know, this block grant alone is not the full story. But I do think that those are the areas that we're leaning on to try to get to some of what you're talking about.
So I don't necessarily say that I'm saying that the block grant's not enough money. I'm saying I don't understand what the block grant is doing. Because I'm looking at the allocation plan, you know, and I see 73% of the maternal and child health plan is going to administrative expense. I see 55% of the children and youth with special needs healthcare is going to administrative expense. So it's going to administration, which is basically the staff, correct? So I guess that's my thing. Like when I'm looking at prenatal case management at $200,000 and, you know, information and referrals at $200,000, but yet the administration being $2 million. What are we doing? Like where do I get the breakdown of what that $2 million worth of headcount, worth of resource, worth of administrative expenses is helping me reduce maternal mortality?
No, I understand that. And I think that what I would say is that whenever we get a grant like this, at the end of the day, we need to get that money to the people who are going to do the work. And in order to do that, we need staff to actually identify what is the scope of work, what is the contract going to look like. That's not the only part, you know, I'm just saying that's part of when we say administration is we need people who are going to actually identify who are the best players in the state to actually do this work. Where are the greatest areas of need? Who do we want to do this work so we actually achieve the outcomes that we're looking for? We can't just send all the money out because we don't know where would we put it. We need staff who become knowledgeable and understand the landscape of what's going on in order to get the money to the right places to be able to do that work on the ground in the places where it's going to have its greatest impact. So I understand what you're saying, that it feels like a lot of it is going to administration. It's not all of it, but we do need people to be able to help get the work and the money to the people who are going to benefit from it most.
So I guess I need to understand that then, because this paper right here that we have from OFA, 73% of the money is going to administration, which leaves $700,000 that's actually going to the programming. That just seems incredibly lopsided to me. So I understand we need people to know which programs to do and all of that, but I don't know that we need 73% of a $2.8 million grant to go to administration. So if we can get that detail, I would like that. And then for the last round of questions that I had with the asthma and the health district.
So we'll follow up with you some additional information on that administrative expenditure line, because one of the questions that my team is also raising here is some of this may be contractual money that is going to communities that are being listed as administrative. But before I say that for sure, why don't we get some more detail on that and follow up with you?
I would appreciate that. And then for the last set of questions that I had with the asthma providers, I was wondering if you could also provide to Madam Administrator where in the budget we have the services that are being provided for the rodent and pest control, and which specific programs and spending are being sent to the groups to look at what we're doing in that area. I'd like to, if you can get that breakdown to Madam Administrator so she can get it out to all of us, I'd appreciate it.
Okay, we'll follow up on that.
Thank you.
Senator Anwar?
Thank you so much, Madam Chair. Commissioner, I wanted to draw a parallel. So for mental health issues, the federal government has an allotment process, somewhat of a sense of transparency around it. They look at the risk, the population at risk. They look at the fiscal status of a community through an index, and also the cost of services. And that is a feedback loop that allows us to be able to say, okay, the challenge of the disease burden is increasing. There's an opportunity to give more funding. Is there something like that for the federal government for public health? And if there is, what can we do to make sure that our feedback loop is appropriate to the situation at ground?
This is one of the challenges in public health. You are correct that they will look at the burden of a given problem in a community. Now, what we know is the minute you start doing a really good job, you have less burden of that problem in your community, and then you get less money because you don't have as big of a problem. So you want to have enough of a problem that you get money to address the problem. I'm not saying we want to persist problems beyond what they're due, but we do know, for example, if you look at other parallels in public health, for example, if you look at syphilis or sexually transmitted diseases, the minute you have a lower amount of a given disease, you get less money to deal with it. Now you pull back your public health response, and now you see that disease start to come back. And so in public health, we're always dealing with that challenge. So we do get allocations from the CDC based on certain criteria, or HRSA in this example, for example, for maternal child health. There are certain areas of the country that may have even worse numbers than us. You know, we certainly, as a state, look pretty good, but we know that we have specific areas that need help, as we've already discussed with Black maternal health as an example. But there may be other states that have worse problems and they may get more money than we do. So I think that is part of the feedback loop that we're always working with our federal partners, is to justify why we should get money to be able to sustain the efforts that we have, no matter what the public health response is. Because just because a problem looks like it's being dealt with and starting to go away, public health problems are insidious and they keep coming back. And if you take your foot off the gas, they will recur. So part of what we're trying to do is show that we need sustained funding to be able to make sure we keep things on the right track.
Thank you so much. Thank you, Madam Chair.
Representative Johnson.
Thank you so much, Madam Chair. Just to follow up on the conversation that was started by Madam Chair with respect to breast cancer and the requirements. We had mentioned both the Affordable Care Act and Connecticut regulated healthcare plans, but we didn't mention the ERISA plans, the Employee Retirement Insurance and Act that actually is just regulated on the federal level, and to the best of my knowledge, doesn't have any requirements to make sure that breast cancer diagnostic services are provided, or at least to the very requirement that we have created here in the state of Connecticut, that if you have dense breast tissue, you would be able to obtain follow-up coverage from your insurance coverage. And also, this is also covered through the Medicaid program, I should also mention as well. So I'm wondering, what is the Department of Public Health doing for those who don't have access to coverage for breast cancer diagnostic services under their ERISA plans that they aren't required to actually regulate access in those circumstances? And if you don't have the answer to that, I'd be glad to look and see where the free services are coming from, where we might have a place to go for the diagnostic services that aren't necessarily covered by insurance or Medicaid.
So we do have free mammograms that are available to uninsured and underinsured individuals. The scope of ERISA plans and self-insured plans is a little bit beyond my scope of knowledge. And, the Federal Department of Labor would probably be able to answer that a little bit more. But what I can say is the Department of Public Health does fund free mammograms for uninsured and underinsured women in our state, and happy to provide that information to you to give you.
Thank you. Very excellent. I need that. I've had constituents ask me about that because they've been refused coverage in these circumstances. So thank you so much for your help on that, and I'll be looking forward to seeing it. Thank you.
Thank you.
I also had a constituent that was denied coverage, but I worked with the healthcare advocate to get her covered. Representative Walker.
Thank you, Madam Chair. You said earlier, there are two things you said. One, you said that 80% of your funding in DPH is federally funded.
That's correct.
So when you rely on federal funding like that, how is it possible to really maintain the funding that you said is so critical in your programs? You're smiling at me and saying, that's my problem. Did I answer my own question?
Well, yeah, yes, in part, that's the challenge. And I think, we've had many conversations over the years through COVID where we got a lot of COVID funding and, you're trying to sustain a workforce that is managing a $400 million budget. And now you go to a $1.2 billion budget and you don't have the fiscal or contracting staff and you have to hire people up, but then you're going to have to let people go at some point when you don't have enough money to keep funding people. That is one of the challenges of public health departments around the country. We're not unique. This is one of the things around public health throughout our country. Most state health departments have similar funding structures. And so when you hear about the need for CDC funding, this is why a lot of their funding is passed through money to us. And it's really helps us as a health department sustain all the public health work that's actually happening in our state.
So our public health agencies in this country are so vulnerable.
That is correct. And you saw that come to light in COVID.
Yeah, we really did. I have one other question. You said that you guys like data and you collect data. So you collect all the births and you keep them year by year and you do it for the regions and everything. When we talk about childcare, are you part of the projection on how much childcare we will need, let's say in 1 year, 2 years, 3 years, that in the state of Connecticut? Are you part of that conversation?
To my knowledge, I don't know if we've had anybody who sits on any sort of committees, if there may be on this topic, but certainly happy to be part of that conversation.
So you have not, because I think
To my knowledge, there may be somebody at DPH who's been sitting on a group.
I've asked about it and nobody's done it, but the reason why I say is because we have such a hard time trying to predict how much we need. I think you're holding the information that probably could help us be a lot more efficient in doing that projection. So we will call you. Thank you very much. Thank you, Madam Chair.
Thank you. Representative McCarty. I would remind everybody that we still have a number of other speakers, 3 other state agencies, and we do have to finish sometime.
Okay, thank you. I'll be very brief, and I didn't see it actually in the allocation plan, but I thought I'd give the commissioner the opportunity. I know part of in working with the health department, looking at strokes and keeping the registry and trying to reduce heart conditions with stroke. If you'd like to just comment on how that plays into this allocation plan.
Yes, thank you for that question, because one of our challenges was this last session, a stroke registry was mandated for us to do, but we didn't have any funding to do it. So when we got that one-time additional funding for FY24, we're putting that funding to be able to help set up that stroke registry that you're talking about. So it was fortuitous and good for us that we got this additional funding and was able to help us fulfill that mandate that the legislature gave us.
Thank you. Thank you.
Representative Case, did you have a question?
Yes, ma'am. Thank you. So Commissioner, you just stated that 80% of your budget is federal. Prior to COVID, how much of your budget was federal?
Same, probably about 75. It went up to about 85 in COVID. I kind of averaged it to 80, but we've always been like that.
So in our budget right now, we have 133 million in 24 and 155 million in 25. That's taxpayer dollars here. That's not federal, correct?
I'm not sure which.
If I look at your budget line item in this year's budget.
Oh, in this, yes, if you're looking at something that is a state budget, we can certainly get back to you with more information. It would be state dollars. So when you're talking about whatever state dollars you see in a state budget, that would be that, 15 to 20% of our overall budget.
So our portion here that we pay is 155 million. So you have 80% more than that you spend? I'm looking at your budget right now.
You mean not related to these block grants, right? You mean our overall budget?
So that's, excuse me, I'm sorry. Do you have any questions on the block grant, Representative?
My
Case?
question was to her statement that 80% of the budget,
I understand that.
including
Do
the
you have any
block grants,
questions on the
is
block
federal.
grant right now, sir?
I'm asking a question on a statement she made, the 80%.
I understand that, but we're not talking about that. We're trying to get through the block grants right now. And I have no problem with the commissioner's going to be here. And we've got 3 other state agencies. So if you want to talk to Representative Case about the difference between your budget and the amount of money you receive from the federal government, that would be fine.
But if the statements are made and we have questions, we have a right to ask. I appreciate that. We'll talk about it after, but realize 155 million is in this budget for your agency.
Yep. We put a lot of money in the budget for public health. Thank you. Appreciate it. Any other questions? Senator Gordon?
Thank you, Madam Chair. This will be my second question and last question. Commissioner, I just wanted to make certain it's clear. I know when we look at reproductive health services, which I understand are important, there are those who do need it. Certainly, especially in the low income demographics of our state. My understanding is a lot of the money that does go into those services that aren't necessarily showing up in these dollar amounts in these tables, that's federal money that comes in that then is that administered then through DPH, or is that money that you don't administer but otherwise is going to those services? I just want to make certain that I'm clear. And then also people are clear as well, because they may look at some of these dollar amounts and say, oh, they're small. But I know there's a lot more money that's spent, for example, for Planned Parenthood and other services.
Yes, absolutely. Again, these block grants are just one piece of the entire puzzle. For example, last year, the legislature allocated ARPA dollars separate and apart to Planned Parenthood as an example to what you're talking about. So these numbers may look small, but there are multiple funding sources usually that go towards reproductive health.
Thank you for the clarification.
Any other questions? Representative Nuccio?
Okay. I'm a math person. I just want to make sure we got this here. So these grants, the 4 point something million and the maternal and the 2.2 million in the preventative. Are these the federal dollars then that you're saying that you're getting? That's part of the 80% question that Rep. Walker asked, right? So these dollars are the straight federal dollars?
Those are 2 grants of federal dollars, but I would have to give you an exact number, but we have maybe 100 federal grants. That 80% number that I mentioned references many, many grants that we get as an agency. Part of what our staff does is apply for grants on a regular basis. So these are just 2 particular grants that we're presenting and talking to you about today.
That's part of the 80% though.
That's correct, yes.
Right, okay, so if it's the 80%, if I just use your 155, that means about 775 total budget. Most of that comes from the federal government. The 155 is the state piece of it. I guess then my question to kind of loop that around, I think in my mind, when I talk to Commissioner Beckham, the federal dollars come in, they go to OPM, they go to you, you feed them out, right? So that's where we would see the federal dollars there. They would give it to you, you would get it out into the community programs, all these programs that we see here. So I guess that then gets me back to my question that I'm hoping you can give us feedback on is, of this federal grant of 2.8 million, why is 2 million of it just staying in admin, right? Because they have 155 million that you're getting from the state resources, which I would assume that is going to be for staff, right? But I guess I
think we're going to have to get back to
yeah, it's
more
murky.
details.
So
I think we'll have to get back to you with more details, because for many of our staff, they may wear multiple hats. They may have a percentage of them that is going towards the block grant, a percentage that's going to a different grant, a percentage that's working off of state dollars for state programs and the like. So I think to your specific question on that administrative line, we'll get back to you with more details.
Okay, and if you could just provide maybe a waterfall of the, you know, if your total budget is 775 million, of which 80% comes in from federal, 155 comes in from the state, and then here's the federal dollars and how much of that is then going back to support the state staff. I'd like to kind of see how it all functions down from the 100% down to the 20% that the state has.
Will do.
Thank you.
Thank you.
Any other questions? Seeing none? I'm sorry. Okay, Lisa. Senator Seminara.
Thank you so much, Madam Chair. I just want some clarity on what you just said, so I understand things clearly. you said that that people's salaries, is it people's salaries, the administrative monies? Are those people's salaries?
I think that's what I was saying, that we need to give clarity on, because I think what I'm hearing from the staff is we're not sure if in the way that this has been outlined is some of it is contracted dollars that goes out, but certainly we have staff. What I was trying to say is we don't have staff necessarily that only work on one project.
Right.
Because if they work on one project only, when they're not there, nobody else can do that work. And we need to sometimes divide up responsibilities. So their effort might be on one grant and another grant, or also on state work.
And I can absolutely appreciate that, that scenario and why you would do that. That makes an incredible amount of sense to me. My question is, if we're talking about staff salaries, I guess my question is, federal dollars and state dollars are combined to make up people's salaries? That's my question.
So people's salaries are their salaries. How their effort is spent and how on the backside we fund people's salaries
Correct. That's my
depends on
question.
what they're working on. Okay, so for example, if we have close to 800 people that work at DPH, but 400 some odd are maybe funded through state dollars and the rest are funded through federal dollars, that would be sort of an example.
Are people duly funded? That's my question.
Sometimes, depends.
Okay.
It depends on the work.
Great. Thank you so
Yep.
much.
Commissioner, next year, when we all come back for session, we're gonna have a whole meeting and you're gonna tell us everything you spend on your budget and where the funding comes from.
I look forward to our
I
appropriations committee
think-
testimony.
I think so. All right. Anybody else? Nope. Seeing nothing, you're all set, Commissioner. Thank you very much.
Thank you very much.
Up next is Representative Navarrete, Commissioner Navarrete, I'm sorry. She's Louise. I'm sorry, Commissioner. The floor is yours. And Commissioner, same thing for you. Please talk about all block grants under your umbrella, and then we'll ask questions.
Good afternoon, everyone.
Afternoon.
So greetings, honorable members of the Appropriations, Human Services, and Public Health Committees. My name is Nancy Navarrete. I'm the Commissioner of the Department of Mental Health and Addiction Services, and I have with me Cheryl Aurora, and she is the CFO for DEMAS. I'm here before you today to respectfully request your approval of 2 block grant allocation plans: the Substance Use Prevention, Treatment, and Recovery Services Block Grant, formerly known as the Substance Abuse Prevention and Treatment Block Grant, and the Community Mental Health Services Block Grant, which we collaborate on with DCF, Department of Children and Families. So I will begin with the Substance Use Prevention, Treatment, and Recovery Services Block Grant, and that's page 4 of your OFA document if you're following along there. So this block grant provides funds to states to develop effective alcohol, tobacco, and other drug use prevention, treatment, and recovery services. It should be noted that we are required to set aside at least 20% of the funds for primary prevention strategies, which focus on preventing disease or injury before it even occurs. And you heard the previous commissioner talk a little bit about that strategy. We not only meet this requirement, but we exceed it. For most of the plan, the recommended allocations before you today remain mostly unchanged from last year. You have my submitted written testimony, and I want to bring to your attention a few of the items within the plan that have changed. So funding has been increased in recovery support services to support 2 main efforts: expansions to our access line which provides assessment, referral, and direct transport for people with substance use disorders, or SUD, to treatment services. So sometimes people don't have a ride to detox, and we will give them a ride to withdrawal management or detox services. And the second area is increased capacity of employment service programs for individuals with substance use disorder. Any other changes to allocations between 24 and 25 are due to the timing of payments for certain contracts or a change in funding source and do not reflect any reduction of services. Please also note that DEMIS is retaining a larger carry forward in fiscal year 25 compared to previous years to prepare for the end of various federal grants that were received during the pandemic, and is assessing how those funds can be used to promote continuity in service delivery. In closing, these funds are instrumental in helping provide a range of substance use treatment and recovery supports to meet clients' needs, including residential withdrawal management, intensive, intermediate, and long-term residential care, outpatient treatment, medication-assisted treatment, and also community support services like case management, vocational support, transportation, and outreach to those in need of treatment. As I noted earlier, these funds are also used on prevention and health promotion services and can be focused on individuals that are not yet in need of treatment and help preclude substance use through targeting based on whether someone is a member of the general public in a high-risk environment or have certain characteristics that make them at risk for developing a substance use disorder. So happy to continue on to the mental health services block grant or pause. Okay. Okay. So this piece of testimony is requesting approval for the Community Mental Health Services Block Grant Allocation Plan, which we collaborate on with our sister state agency, Department of Children and Families. This is on page 5 of your OFA document. This block grant funds mental health services for adults with serious mental illness, also known as SMI, and a portion is shared with DCF to provide services for children with serious emotional disturbance. You have my written testimony, and I'll provide an overview of the highlights of changes in the adult portion of the plan before I turn it over to DCF. First, it's important to note that you heard again from the other commissioner that this block grant only represents a piece of our spending on mental health, on the mental health service system. This block grant is intended to address emerging mental health needs and supplement state funding for various levels of care, like emergency crisis services, outpatient clinical services, residential services, employment support, case management, and social rehab. Like the other block grant I spoke about, the recommended allocations before you today remain mostly unchanged from last year. There are 2 line items that increase that I would like to draw your attention to. Funding for residential services is being increased to address rising costs and increased acuity within this level of care. And additionally, funding for case management is being increased to expand support services for individuals who have a serious mental illness and are experiencing or at risk for homelessness. Any other changes you see between the allocations between 24 and 25 do not reflect reductions in services. For example, the decrease in crisis services is due to the end of a one-time training series that took place in fiscal year 24. I also want to note our intent to prepare for the end of various federal grants that we received during the pandemic through the retention of a larger carry forward than we had in previous years. In closing, the funding in this block grant provides is extremely important to community-based providers across the state as they work to support our shared mission of developing community-oriented, cost-effective services that allow individuals to be served in the least restrictive and the most appropriate settings in the community. So I can take questions now, and then you can hear from DCF, however you would like that to go.
So I had DCF written down as a separate team discussion.
Okay.
I'm not certain. I
So I'm
think
happy to handle questions on the adult portion and then,
then we'll
my
have
colleague
DCF
can come up.
speak.
Yep.
Are you all set now, Commissioner?
Yes. I am.
That's all of yours. So, Representative Walker?
Thank you, Madam Chair, and we're interchangeable. Thank you, Madam Chair. I just wanted to ask, and I think you answered it, in the changes in 25, I think it created the reductions that were in the outline in under the substance abuse prevention. Is that why there is a negative
So, I can go through
the
pro-
prevention and health promotion?
Oh, I see. Yes, that one is due to delays in how the contract was implemented.
Okay.
So you can see fiscal year 24 is artificially inflated due to the timing of the contract implementation, and then it goes back down again. So that's the minor fluctuation.
I see. So you sort of covered the cost and then took it back as soon as you got the.
It just the timing, it might have, the first payment might have been in fiscal year, or the last payment might have been in fiscal year 2024. And
Mhm.
so it looks like 25 is short. It just means it fell before the fiscal year deadline. But if you look across all 3 years, it's actually the same amount of money.
So just on that same note, the balance forward for the previous year was 631 more in 25 than 24. That was the increase that you received in this grant? The balance
I'm
forward?
sorry, can you, the carry forward, the balance?
Balance
forward?
forward from
Oh,
previous
yes.
year?
Yes, so it increased from 2.4 million to 3 million,
Okay, so
and
that,
that's 26%.
okay, so that,
And
okay.
that money is still available
Yeah.
to us. And so what we're trying to do is prepare for when any of the other federal funding falls off, because during the pandemic, there were a lot more opportunities for mental health and substance use services. So we want to be judicious and really intentional about being able to cover some of those. We can't obviously cover every federal grant that goes away, but we want to make sure the most important ones do get covered.
So you can use the monies to cover other, interesting. Okay, thank you, Madam Chair.
Senator Anwar?
Thank you so much, Madam Chair. Thank you, Commissioner, for the presentation. Commissioner, on the residential component that you talked about, there's an increase in the budget for the residential component. And its description states that it is acuity has gone up. I was wondering because the number of beds needed has gone up. Is that part of that equation too or not?
No, it's not paying
Ouch.
for addition, in this particular example. Again, this is $10 million compared to our $752 million budget that is DEMIS on the state side. So this particular portion is helping people be successful in a community level of care that is pretty intense, but allows them to live in the community. And so since people are coming to us with more comorbidities, we want to make sure that they can stay there and be successful and not have to go back to the hospital.
Thank you. And then the second question was about the chronic homelessness and the Mental Health Association. We know from data that if you are able to address the homelessness, you would be able to address this. Now, that's mentioned. Is the budget going to be in partnership with Department of Housing to focus on that group, or is this going to be under DEMIS?
This particular piece is DEMIS, and what we do is, but we work with DOH all the time. So we're part of an interagency council. When there are vouchers available, DEMIS will often provide, if there are dollars available, the wraparound services again, so that folks can be successful neighbors, stay housed and not lose their housing. So that's very important. In this example, what we're doing is specially trained folks will help individuals connect to federal entitlements. So you know, if you don't have a mailbox or a telephone number, then it really helps to have a case manager who can walk you through that process to make sure that you check all the boxes to be able to get those entitlements that you qualify for, rather than have to do that on your own.
So just to clarify, this part of the budget increase will help homelessness?
Will help individuals who are homeless connect to those resources, so then they could get Social Security, disability, for example, and then that opens the door to more services, speaks to the social determinants of health that you all were discussing before.
Thank you so much. Thank you, Madam Chair.
Representative Nuccio.
Thank you. So I have a follow-up to what Representative Walker was asking. In relation to the balance forward, I noticed in 2023, we had about $155,000. And then in 2024, we jumped to 2.4 million, and now we're at 3 million. And if I understand you correctly, that money is kind of being put aside to handle the winding down of the federal government's free COVID money, right?
Correct.
Okay, so is there a concern then where probably if we have $3 million left at the end of the year, we're holding money back that could be going to people in need? And we're not going to continue getting that federal money in 10 to 1. You know, we're going to have to evaluate the entire budget going forward to figure out where money is going to come from. Are you creating a cliff for yourself by having millions of dollars that we're holding back to kind of offset what might or might not come that eventually is not going to come?
It's, well, there are proposed increases to both of these block grants, although that we won't know that until spring. So there are always proposals, and then that depends what gets passed through Congress. So it's always a balancing act. You're absolutely right. And usually our course of action, as you can see from 23, is to get us the most money out into the communities. In this case, it's a small enough amount of dollars that it can help us do things in a planful way. If we have to wind down some services or bridge some services, it will be a good way to be able to do that very planfully, so that people are not cut off from services, you know, at the end of their other federal funding.
So when do we stop doing that? Because it's over 10% of the budget. I don't consider that small when we're looking at like, you know, a $20 million grant.
It's smaller when you look at the entire budget that DEMIS has, which is over $750 million. So this is a very small percentage of that. And, you know, we're evaluating gaps in services and need all of the time, very data oriented. So not to say this couldn't be amended, but as we're looking across all of our services, we want to make sure there's enough of an off-ramp for providers and for individuals receiving those services to make sure it's done in a planful way.
Okay, and then the last quick question is, would you agree with what you just said leads me to ask the same thing that we basically were asking DPH Commissioner, is would you say it's accurate that about 80% of your funding comes from the federal government? No? What would you say your percentage
This is a tiny percentage of our total budget. So our state budget is over $750 million. This is 20 million on the substance use and 10 on the mental health. So it's a small percentage. In addition, in total, we've applied for and received $77 million in federal grants.
Okay, so 77 million is your total from federal perspective. So you're not more,
No,
okay.
it's different.
All right, thank you. Thank you very much.
Senator Gordon.
Thank you, Madam Chair. I just have one question right now. Commissioner, thank you for the presentation. I just have a question about the regional behavioral health action organizations. I know my Senate district, which is 13 towns in Northeast and into somewhat North Central, I span 2. I think it's number 3 and 4 for those organizations. I know in your report you state that you work with them, and I appreciate that. I'm assuming that is there grant money that you're providing to them, either from the federal government or from the state itself? And then my second part of that question, which will make two questions, and I'll reach my limit, is do you have numbers that you can provide, maybe not on the spot, but I'm happy to talk with you offline about how that all breaks down amongst the different of those 5 organizations, so I can have a better understanding of how that funding flows to the different parts of the state, especially northeast part of the state and north central part of the state.
Sure, we can get that detail to you, but yes, the RBHAOs are an essential partner to us, especially in the prevention and health promotion arena. So, and they are an essential part of our Connecticut Suicide Advisory Board. They're also an essential part of the council that advises us on priorities for these 2 grants, both the substance use side and the mental health side. So every year they issue priority reports. They have on the ground knowledge. They're doing the regional work. So they are essential partners for us, and we can certainly provide you with a breakdown of state and federal dollars they receive.
Thank you, and I look forward for those numbers. Appreciate it.
Representative McCarty.
Thank you very much, Madam Chair, and welcome, Commissioner, and thank you for the report. And I'm pleased to hear that the regional behavioral health organizations are being highlighted for the great work that they do. We still have the opiate epidemic that we're dealing with, and we know that we need more funding to look at what resources are out there to help. And I'm particularly concerned with long-term recovery support. Could you just talk a bit? I know there's some in here, but I had asked this question in the past, and I don't know whether DEMA's ever had the opportunity to work with the federal side at looking, when you look at the allocation plan for substance use prevention and treatment, it's much smaller than the mental health. And I'm not arguing that, but I wondered, is there any room for movement between the 2 block grants? Does DEMAS have any of that authority? And is it worthwhile to look perhaps to arguing for that if you see a greater need in one area, but you have funding, but you can't cross use it? So that's just a comment, but just want to put that out there, because I had heard that myself at some of the regional behavioral health organization meetings, that would really be useful. So that's one question. And then if you wouldn't mind just talking about the long-term recovery services.
Sure. So in these grants, actually the substance use grant is larger than the mental health grant. In terms of our state budget, it's flipped, and there are more mental health dollars than substance use dollars. So when it comes to the federal dollars and the 2 block grants before you, we cannot move money between these 2 grants. So they're specific to substance use and specific to individuals with SMI, serious mental illness, and children with serious emotional disturbance. And then in terms of long-term services and supports, so we have a are you talking on the substance use side? So we have a variety of services. So we have services that address problems that are immediate. So if someone shows up in an emergency department, for example, being able to connect them to services in the community. And we have services that are more long-term. So whether that's in the form of outpatient services, case management, you've heard some about our employment services. Those are all longer-term services. We also have community centers throughout the state of Connecticut where people can gather, get those resources, give back to their community, be part of a telephone line that supports other people new to recovery. So there's a wide range of services across the continuum.
Very much.
Representative Gilchrist.
Thank you, Madam Chair. Thank you, Commissioner. Just wanted to ask about services. So back to the conversation we had with the previous commissioner about maternal mortality. One of the findings of that report is that the individuals who have passed away had some substance abuse struggles. So wondering, in this block grant, are there any services or supports for, in particular, women, but parents who struggle with substance abuse?
Yes, there are. In fact, that is one of the priorities of the federal government in the substance use block grant. We pay for residential treatment for individuals that are both single and or pregnant and parenting. So there are two different kinds of services for those individuals, tailored to address things like reproductive health, trauma, and recovery. We provide childcare for individuals that are engaged in IOP, intensive outpatient services, for example, connecting individuals to care. Not part of this grant, but and part of some of the other work we do, we have a statewide line where providers can call in if they have a patient that is pregnant or post-pregnancy, and they have questions about how to treat mental health and substance use. We will provide that guidance to them so that it kind of extends our reach and allows people to have providers in the community to have access to experts in the field.
Fantastic. Thank you, Commissioner. Thank you, Madam Chair.
Representative Dillon.
Thank you, Madam Chair, and thank you for your presentation, Commissioner. Good discussion this afternoon. I wonder if you could explain further, and perhaps I missed it, the 5% reduction in emergency services.
I'm not quite sure what the question is. I think maybe you're talking about in 2023, there was no reduction from 24 to 25. In 23, there was a reduction in the crisis hotline out of the block grant, but there were other federal funds issued specifically for 988 and crisis that we were able to pay that out of. So there were no reductions in services. In fact, those services increased through the various federal grants that were received. I hope that answered your question.
I was looking at the 121,000, the 5% reduction in emergency crisis dollars. And I have a particular interest because the General Assembly adopted some very, very important legislation that provided for the safety of workers that go out to individual homes. But if I recall, state employees were exempted. And I'm concerned about the safety of the public employees who may go out on emergency crisis runs. Do you have a protocol for that?
I am sorry, Rep. Dillon, your audio is very bad. I can go back to the emergency crisis line on the mental health block grant document, and that is that reduction of $121,000. $121,000 was a one-time training. It wasn't services. It was a one-time training. So that's that 5.4% reduction. But I'm sorry, I couldn't hear the rest of your commentary.
Thank you. And I don't know if that can be fixed if you can hear me now, but or we can follow up later. But I'm concerned about the safety of state employees who do emergency crisis intervention because they were exempted from the legislation that we did last year.
Okay, thank you for that comment. Within the department, we have done several things. We've provided specialized training to our mobile crisis collections.
I'm sorry, Commissioner. I apologize. Pat, Representative Dillon, we're just going to try to stick to the block grant that we're talking about and not go into other programs that Demas is doing because we're getting a little bit far astray. So I'm sure that Commissioner will be happy to talk to you at length about all of the Demas programs.
Thank you, Madam Chair. That was stimulated by the emergency crisis reduction, but I think your comments are on point and we can discuss it offline.
Thank you. I appreciate that. Representative Case.
Thank you, Madam Chair. Good afternoon, Commissioner. So I talked basically a little bit about the case management and the need for services. Through this grant, how would we get services out there? Because everybody that comes into a catchment area or comes in that's homeless does a CAN intake, coordinated access network intake. Is that where you're getting your information on in order to help people? Because we are really falling down on the issue of mental health and addiction with the 13% increase and the shelters and homeless population being run through Department of Housing.
So that is under Department of Housing, and they're the ones that have the but we do partner with them. So we sit at the table with them when they are planning for services. And our role is primarily to wrap around people or to do that outreach and engagement. We have again, separate from the block grant, we have special projects around train stations, for example. If folks are sleeping in train stations, we have specially trained workers to go out and try and engage those folks into services and into housing. So both the mental health, substance use, and the housing component.
Through you in this block grant, is there a calculation that shows how that money would get out? Because I'll be sure you, on the board that I serve up in the northwest corner, we have such a problem in the woods where we go out there and see people, and majority of the time you recognize or figured out the person by the bottles, prescription bottles or whatever that are at their encampment. They're in tents. We need to find a way to get out there with them and figure out how to work on the addiction and those problems so we can bring them in and get them housing, but then find a way to sustain it. And I don't know if Department of Housing has the ability. I understand you work with them, but through this grant, how can that enhance? Because it's one of the bullet points that you spell out.
So not necessarily through this block grant, but through our general funds. We do have outreach and engagement teams that do exactly what you're suggesting is happening. So it may take months, it may take a longer than that for us to get a name, to get a person interested in services. But these are folks that are specially trained to develop that relationship. We have street psychiatry. It's another program. That particular program is in New Haven, but we're able to prescribe and do that outreach on the streets so that we're not expecting people to knock on our door. We're knocking on their figurative door and trying to develop that relationship to get them into services.
I'd like just to have a little conversation off record with your people, because it says specifically in here case management who are chronically homeless through the federal assistance.
That's not outreach and engagement, though. That's for the specialized program of getting people on entitlements. So it is for individuals who are at risk for homelessness.
And do you take that off of the CAN system where you can get
No.
people's information?
No, no.
Because what we do is we try to bring people in and give them a PO box so they have a residence because they're homeless. And that's how they get established with the state. I don't know how they get established with the federal government, but that's how they can get mail and be actual start to be productive.
We go into shelters, we go into the encampments. We go to people. We're not expecting them to come to us.
Okay, I'd love to catch up with you on this because I go out in the woods. We have a drone that goes out and tries to find. It's crazy with the 900 square miles. We'd like to see some help up in the northwest corner. So I appreciate it. Thank you very much, Madam Chair.
Are there any other comments or questions? Representative Dathan?
Thank you very much, Madam Chair, and thank you, Commissioner, for being here today. I wanted to focus on the part of the block grant, the substance use prevention, as well as the community mental health services block grant. I wanted to understand what part of the block grant goes specifically for peer support services. I understand that agencies around our state, part of CCAR, for example, receive this sort of funding. And I was hoping, you don't have to give it to me today, but if you could provide to Madam Administrator, who will share with the committee, the amounts of funds that go to support peer support services for those two grants in our state. I would love to understand who the recipients of those grants are. And I understand also from reading the information as part of the background that these grants are not entitled for sort of matching other federal money. So these funds would suffice for people who may be not able to receive those services under Medicaid, so that those different agencies that are receiving these funds for peer support services would still in the future be able to receive those funds if we ever changed policy to allow Medicaid matching and reimbursement for peer support. But I would just like to get an understanding which of the agencies are receiving funds as part of that block grant. So thank you so much for your presentation today, and thank you, Madam Chair.
Are there any other comments or questions? Seeing Representative McCarty.
Thank you very much, Madam Chair. Just quickly, Commissioner, I noticed in the Community Health Allocation Plan, there's a section on identifying early serious mental illness onset and what is being done to identify and perhaps prevent some of the more serious disorders. Can you just talk a little bit about that? Because it caught my eye when it said to prevent schizophrenia and some of the spectrum disorder. And I'm wondering how, if we have data to back that up.
Sure, I can get more information on the data to you, but there is a set aside for first episode psychosis. The hub of this started in New Haven, collaboration between Yale and CMHC, and it has grown and these services are now available statewide, where individuals, if a person is having what looks like a first break, they may be young adults, they may be in their later teens. We have evidence-based treatments to educate families. This is a scary time for people if they're not understanding what signs and symptoms of psychosis are. We link people to resources to hopefully very early on change the trajectory of that illness so that perhaps the disability isn't as great as it would have been if it had gone undetected.
Right. Thank you very much for that. And then I'm not going to speak, but just wanted to also point out the training for the families and connecting them with resources. I think that is essential. So thank you.
Any other comments or questions? Seeing none. Commissioner, you're all set.
Thank you.
Up next is DCF, the whole DCF team. So so whomever is talking for DCF. Yeah. Commissioner? Commissioner, the floor is yours, so you can talk about all your block grants. How many do you have?
We have one.
Okay. Go ahead.
So I do come generally with a gang, so we're all here. So first of all, good afternoon, distinguished members of Appropriation, Public Health and Human Service Committee. My name is Jody Hill-Lilly. I am the Commissioner for the Department of Children and Families. For the record, I've been here just short of 8 months. Went by fast. I want to say I'm grateful for the partnership that I have with the Department of Mental Health and Addiction Services under Commissioner Nancy Navarrete. We work really closely together to make sure that there's a seamless transition for services rendered to children and youth and as they transition into adulthood. Also grateful for the partnership that we have with the Department of Social Services and the Department of Public Health. Truly, it is a team effort to make sure that we are ensuring appropriate mental health services are provided to our most vulnerable kids and families and to all of our kids and families who are suffering with these issues facing children and their behavioral health. One of the first things that I did when I took office at DCF was to look deeper into the needs and how our system could respond to children's behavioral health. And I wanted to go deeper both in our protective service arm of our department as well as our behavioral health arm of the department. With this, I developed the Division of Behavioral Health and Wellbeing. And again, this was due in part to the devastating aftermath of COVID-19, which is in my mind a shadow pandemic that we are in. Certainly, youth suicide is a major piece of our work, and my thoughts and prayers go out to you and your community, Rep. Dathan, which is why we had the forum that we did on suicide. We are facing things that I haven't seen in my 36 years with our youth and young adults, which is why an all hands on deck approach is really necessary. So to head up this new bureau, I tapped Dr. Nicole Taylor, who by training is a medical director. And part of what I wanted to do was to destigmatize this conversation on mental health. It has to be a discussable topic for all of us. And we really wanted there to be no interruption between the conversation on medical condition and your behavioral health conditions, which is why we sought to put this arm underneath Dr. Taylor. So she's going to provide the formal testimony, and I'm here along with the team behind us to answer any questions that you may have.
Thank you, Commissioner. Good afternoon, members of the Appropriation, Public Health, and Human Service Committee. My name is Nicole Taylor. I'm the Chief Administrator in the Office of Behavioral Health and Wellbeing at the Department of Children and Families. I'm also joined this afternoon by Dr. Frank Gregory, Administrator of our Behavioral Health Community Service at DCF. Thank you for the opportunity to present the department's proposed fiscal year 25 allocation plan for the children's portion of the Community Mental Health Service Block Grant. The department proposes to use of these block grants funds to continue enhancement of the comprehensive community-based mental health service system for Connecticut children and their families. This system aims to support and successfully maintain children with mental health difficulties in their home and communities and ensure that children and their families receive the care and services that they need where and when they need them. The Community Mental Health Service Block Grant helps sustain the quality of community-based services by providing resources to support activities not funded by Medicaid or other sources. These activities provide the innovation and system development necessary to enhance our system of care. In this way, the Community Mental Health Service Block Grant funds augment state and other federal resources to increase their impact and improve outcomes for children and families. DCF proposes to allocate $3,726,786 from the fiscal year 25 block grant, which is inclusive of prior year carryover funds. Funding is continued at current levels for all supported activities. There has been a recharacterization of some projects within service categories, but funding for each of the underlying program is unchanged. And you have a written outline of the allocations of the programs that are being funded. The department is grateful to the General Assembly for its partnership as we continue the work of enhancing behavioral health supports and services for all of Connecticut children and families.
Any questions? Representative Walker.
Good afternoon, everybody. Good to see both of you. Good to see you today. I have two questions. The first one is, in the outline, I see that the source of funds is the 10 million, but that's included in adult and children. So you have a balance forward of the previous year of 3.2 million. How much of that is yours? Would it be, it would be about a third of that. Is that correct?
Correct.
Yes.
I'm
Yeah.
sorry, the question was about the amount that was carried over from last
Yeah,
year?
the balance forward from previous year, it's a total of 3.2 million, but you don't get, I mean, that goes to both children
Okay,
and
and-
adult.
Yes.
Okay, and I just.
So,
Mhm.
the children carry forward funds was 1.5 million.
That's what I was looking
Okay.
for. Okay, so it's 1.5. Okay. Then in the quality of care best practices promotions program, it's not a lot of money, but can you just explain the quality of care promotion and program evaluation? Is that quality assurance? Is that evaluation of the programs? Is that what that is?
Excuse me, give me a second.
I'm getting heads not
So-
saying yes in the back
Okay.
behind. Turn around, she's telling you.
Yes.
Okay, I just wanted to make sure. Okay, thank you very much.
Yes,
Thank you,
it's a
Madam
good
Chair.
promotion. Yes,
Thank you.
Thank you.
Representative Dathan.
Thank you very much, Madam Chair, and thank you for your testimony today. I just wanted to talk a little bit about the youth suicide prevention and mental health promotion, as well as the IOP programs that are part of this grant. I'm sure I'm not telling, first of all, I should have said welcome and thank you so much for your work to ensure the best for our young people in our state. Good luck to you on that. Was hoping that I could get some more information for those programs to understand. I understand that there are well over 600 children in our state that are on waiting lists to receive services. And I find that really a tragedy in today's what we have going on in our country and as well as in our state. And I'm wondering how this grant, Bach grant, is allocating money to help remove kids that are maybe sitting in emergency rooms on waiting lists to get services. And it's not a huge amount of money here on this. And I'm wondering how we are helping with this grant to alleviate the waiting times for our youth, particularly the number I heard was from the group in Yale, New Haven that helps with our kids that need those sort of services that might be in communities or don't have access to either Medicaid or insurance that help fund these. Thank you.
So I'll let Dr. Taylor expand on this, but we are proud to say that crisis that we were experiencing has changed dramatically. And we believe that that is in part due to some of the services that we have stood up over the last few months, inclusive of and not limited to like the UCCs that we have available to the community. So in short, the numbers are not nearly as bad as they were at one point. And I believe services like the outpatient clinics and the UCCs and other service arrays that we have put into place has served to mitigate some of those issues that we've seen. It's not all the way gone, but it's certainly not in the same place that it was this time last year.
Thank you, Commissioner. And to just expand on that, the allocation to these programs are just from the, are not the total allocation. So there's also state funding in addition to the federal block grant. And as the commissioner stated, we've been tracking the discharge delay in the emergency room and have noticed that that number has been decreasing.
I get routine emails a couple of times a week. So we're monitoring it very closely.
Thank you. not to take more time of the committee, but if you could provide to our administrator the waiting list for such services for our youth. If you can do it by region in our state, because I also have concerns that folks maybe in the northeast corner, the northwest corner, where there's just not as many services available, that we also have a crisis there. So if you could provide that, I'd greatly appreciate it. Thank you, Madam Chair.
Thank you. Up next is Representative Nuccio.
Thank you, Madam Chair. Thank you, Commissioner. I have a few questions that all kind of, I think, link together in my mind anyway, which is sometimes a very scary place to be, but specifically, I heard that chuckle. The early serious mental health illness, first episode, psychosis. I noticed there's an increase of about $125,000. And then I see we have a new behavioral health outcomes, the performance improvement data dashboard development for $50,000, which I'm assuming is just programmed like to create the dashboard. And then I see directly below that, the emergency crisis dollars going down by $75,000. I see these three things kind of almost connected in a sense, especially when we're talking about children and mental health issues. Add to that, I've heard from a lot of constituents and people in the community, not just constituents, but for instance, the state police and stuff like that. There's been like a delay for, again, we're out in the middle of nowhere, but the emergency crisis mobile services. So I'm wondering, are the crisis mobile services for children in here anywhere? Like, how is this kind of working with, first episode? I hear all these things and I immediately, first episode, you got 211, you've got the emergency crisis mobile van, emergency crisis, and then tracking these behavioral health outcomes. So looking at the increase in the dollars that you have in here net over, how do these all connect?
So I just, thank you, Representative, for the question. I just wanted to clarify with the emergency crisis that $75,000 decrease is actually not a decrease. There was just gaps with the contract and overpayment from that prior year. But if you notice from fiscal year 2023, from 500,000 to 875, so it should be at 800.
Oh, okay, so it should be 800 standard.
Right.
So it was just, okay, so that's just a year over year.
Right.
All right, so I guess
Yes.
same kind of question though, with 800,000 emergency crisis, is that, do these things all come together?
You ask a really interesting question, like, is there a delay? What's the intersection? And when we had our youth suicide forum a couple of weeks ago, folks asked, what's the difference between, 911, 288, and 988? And the difference is if you call 911, you're going to get the police. If you call 211, you're going to get someone who can get you to mental health services. But if you call 988 directly, that puts you straight to a service. So we're thinking that, depending on which avenue, I don't know your situation or what scenario you're referring to, but it could be that it was a call directly to 211, which would mean you have to make the referral, which may be a little bit slower, but get you there. We're trying to have this picture of no wrong door, so that if you call 911, you're still going to get to the services that would be directly provided by 988. But if you go through 211, it's more of a referral process, if that makes sense. So I don't, again, not knowing the particulars of the scenario that you're referring to, that's one possible reason for that.
I appreciate that. I think my concern really is around the amount of calls, especially we're seeing go to like the state police or local police departments about kids with mental health issues. And they are calling 911. And then you've got officers that are going out there to try to kind of help with this. And we do have programs in some of our state troopers' offices, like the crisis program, but that works with adults, not children, right? But I do think there's a severe need here. So that's why I was trying to link between the emergency crisis. How does that link to the van and to getting families and kids? Because you've got parents calling police about the behavior issues and such with their kids, and there's got to be a better way.
Yeah,
Right. There has to be a better way.
Agreed, and I'll let Dr. Taylor respond to that specific question, but I will say we have these services available, but actually getting the word out there is the issue. We have billboards, we have, advertisement on buses. I said we need to switch to, I don't know, Instagram or something to get the word out to kids and families, because for whatever reason, there's still this gap. So what we tried to do was to get to schools, because that's a huge referral base. And so we put out lots of flyers to schools so that they can get to home. So that is, I will tell you, an area of focus for us, that we're going to try to figure out how do we get the information in the hands of parents and kids. That's a primary objective of ours, is to get our arms underneath that information gap, if you will.
Oh, I only have one other thing. Yeah, I just think that I'd like to understand that, because again, I'm just hearing that there's there's a delay, again, out in the rural countries, so when we're actually getting the people out there to help. So understanding that, where the vans are and how to get these emergency crisis services out to the rural areas is obviously a big issue for me, because that's who I represent.
Absolutely.
So,
Absolutely.
thank you.
Senator Anwar?
Thank you so much, Madam Chair. Thank you, Commissioner. Thank you, Dr. Taylor. I just wanted on the line items that we are seeing, there's one line item that is there, which is workforce development. Never had any money, does not have any money right now. And I know somebody put it there because perhaps there was something in the past. But if there's a way to clarify that something else is happening around workforce development, which remains a very big part of children's mental health. And another line item is the emergency crisis, which suggests that the total funding for emergency crisis for children is decreasing. So I just want to reassure us all and the people listening in that that money is just part of this part of the block grant, does not necessarily mean that the rest of the budget is decreasing that in any shape or form. So if you could help us with that. Thank you.
Thank you for the question, Senator. For the workforce development, we realized that we had this line item twice. And if you look at the Connecticut Community Kids Care Workforce Development Training and Culturally Competent Care, so we just combined the lines together. But because it was there before, we left the line item there.
And I will tell you that workforce development is a primary concern for us, and we have partnered with CHDI to do evaluations, and recommendations have been made about how we address the workforce crisis for our providers. So rest assured that it is something that we take very seriously and will be looking at intently. Also, again, we have multiple sources of funding. So what you see here is not obviously the total picture.
And I see the cultural competent training and treatment has increased funding. I was glad to see that. So thank you for all the work that you all do. Thank you. Thank you, Madam Chair.
Senator Gordon?
Thank you, Madam Chair. Some of my questions were already asked and answered about the early serious mental illness and the first episode psychosis. As a doctor, I don't take care of kids. I do take care of adults. It's not uncommon that we actually have to intervene. Had to do it a couple of weeks ago, unfortunately, for someone who was very much suicidal. Unfortunately, tried but didn't succeed, and we were able to intervene the first time it seems to have been brought to attention. But when we talk about some of the areas of the state, part of my district that I represent is a number of towns in Northeast Connecticut, and that we border Massachusetts. And there is a lack of resources, not because of a lack of not trying, it's just there is a lack of resources, number of beds, number of healthcare professionals. But interestingly, over the border, if you look into South Worcester County, there's an increase in the services and in the beds. And because of commitments of some of the hospital systems up there to expand beds in Massachusetts has been encouraging that very much. Do you track, my question is, For folks who live in some of the border towns, for example, towns that I represent like Thompson, Woodstock, Stafford, who they can go over the border sometimes. Sometimes folks, when they're in crisis, will head towards a closest place. And there are some of those community hospitals that happen to be over the border, or they happen to be there and they're in crisis. Do you track those folks who are living in Connecticut, their first episode or repeat episodes of mental illness, psychosis is being taken care of, treated initially, mostly in an emergency department, unfortunately, but then they may get discharged back out into the community, but they're not going to be in Massachusetts. They're coming back to Connecticut. Do you have data? Do you track how many of those and where those resources are? Because it's not uncommon people for some medical care jump back and forth over the border for emergency care, just because, again, of lack of resources and some of the additional resources over the border, as I mentioned, in South Worcester County.
It's a great question, and tracking this data just in general has nuances. So for example, if a family has private insurance and they're seeking treatment over the borders, we wouldn't necessarily know that. If the family is Medicaid eligible, they would have to go through a process to get that funding. So we might be able to track that. The short answer is I can try to figure out if we have it, but there will be circumstances where we won't know if they're doing that, particularly if it's private insurance.
No, you're correct, Commissioner.
And I know I'm asking a loaded question, but it is something we do face in the border
It's a good
towns.
question.
And, you know, being someone who practices in both states, I do see it. And it's usually folks in emergencies. They're not looking at what their insurance is. Some of these folks don't even have insurance for whatever reason. And they're just ending up in the emergency department right over the border. So I know it's not easy and you'd have to coordinate with a whole nother state.
Right.
But it is something that's happening, and I can tell you in the adult world, I've been seeing more of it, and some of my colleagues have. I just don't know if that's the case for children, but sometimes they track parallel. So
Absolutely.
it's just something for us to be aware of when we're dealing with the border towns. Thank you, Madam Chair.
Thank you. Up next is Representative McCarty.
Thank you very much, Madam Chair, and welcome, Commissioner, and thank you for your descriptions of the allocation plan. Could you just speak briefly about the respite care? I noticed that there were 303 children that were served, and that primarily keeps the children in the home with care coordination. Is that correct? And could you just describe what we do for those families that perhaps didn't get the services going forward? Thank you.
Thank you, Representative, for the question. So our respite care really offers in-home services for family during a moment of crisis. So it's not an overnight care, respite care. So it helps the family with dealing with whatever is going on right at that moment. And then I'm not sure the second part of your question was regarding.
Just reviewing it, it looked like there was still a gap there in families that may not have received what they were calling for in that treatment, and just a little if we could have more information on that area.
So my apologies, I don't have that information right now, but we can follow up.
Okay, thank you. Thank you.
A lot of people do mistake that for the child going into another home for a period of time. It is absolutely not that. It is more a period of time within a day that gives the family a break. I just want to.
It looks like there's a success rate though for getting
Yeah.
into the home at that point. I'm just curious if we can go the next step and look at that. Thank you.
We'll look into that. Thank you.
Representative Johnson.
Thank you, Madam Chair, and thank you so much, Commissioner, for your presentation. Just quickly, I wanted to see if how we're dealing with the mental health services and some of the emergency services, whether they are part of this is addressing the homeless population, doesn't really speak of homeless population. And I wondered how we are addressing that homeless population, because my understanding is on the Education Committee and Public Health Committees, that the homeless students suffer from PTSD. And I wondered if that's part of the analysis that's going on here. I didn't see it broken out anywhere. Thank you.
So I can say that we're working with Department of Housing to really get our arms around homeless youth. Interestingly enough, in some of our work groups, we ask the question, define homeless, because that will differ depending on who you speak to. And because there are a lot of youth that are couch surfing. And it doesn't mean that they are not homeless. They're just moving from house to house.
Excuse me, Commissioner. I think Representative Johnson was asking, is that addressed in this block grant?
Not with this allocation, but
Mhm.
we are certainly.
You'd
it
have
is-
other programs that do it, but
Correct.
in this allocation,
Not in
is
here.
there's none? Okay.
No.
Okay. Thank you for that, and thank you for the clarification, Representative Walker. I appreciate it. Okay, so if you have information on that, could you just forward it to me since I have 3 homeless shelters? Thanks so much.
Sure. Thank you.
We would just like one in Norwich. Are there any other comments or questions? Seeing none, thank you. Up next, we have the Department of Social Services Commissioner. How many block grants do you have?
We have 4.
Go ahead and read right through them.
We actually have a PowerPoint.
Say it again.
We have a PowerPoint. It's only 3 slides. We'll
Okay.
do it super quick.
It's how many slides?
3.
Okay, go ahead.
All right. So good afternoon, Chairs Austin Walker, Gilchrist Lesser, Ranking Members Berthel Nuccio Seminary and Case, and distinguished members of the Appropriations and Human Services Committees. My name is Andrea Barton Reeves, and I'm the Commissioner for the Department of Social Services. I'd like to thank you for the opportunity to be before you today, and we will go directly to our PowerPoint. I will not read the rest of this, and we will get right to the presentation. So thank you. Can we go to the, actually to the next slide, if you don't mind? Yeah, and the one after that. Get to the right one. Okay, yeah, it's this one. Thank you. We'll go to this one. So our funding for FY 2025 is estimated to be, oh, I'm so sorry. This is Cassie Norfleet Johnson. She's a director in our program. She's an expert on this grant along with all the other experts. So I asked her if she would join me today. So thank you, Cassie, for being here. Okay. So our grant is estimated at about $17.2 million, and we are proposing an expenditure of 19.1 or 0.1, and that includes carryover of about $1.9 million that we've had accumulated over the years. So that carry forward will allow us to give providers a one-time funding increase, and it will also allow the funding from FY 22 to 24 cost of living adjustments that were partially funded by ARPA, and ARPA money obviously is not replicable. So we will be using part of the carryover for that purpose. Next slide, please. So this is really a visual representation of where we intend to spend the money, and is all worked out and laid out in our allocation plan. But you can see that the vast majority of the money really goes to our independent and transitional living services. And then there are larger portions that go to case management and our home delivered meals, or some of our other larger categories. And all of those are there. There are some that are much smaller, like family planning, and some home-based services that have smaller pockets of money that go to them. But the majority of the money goes to our independent and transitional living services. So this, Susan, this is we'll go to the next slide. It's the last one. Yeah. Okay. Thank you. So here are the proposed changes from last year to this year. With respect to case management, we are proposing that we increase our allocation by about $312,000 to support a one-time funding increase and the COLAs that we have built into the plan. The same is true for the home delivered meals. This is a program that has experienced some decreases at the federal level from the Nutrition Services Incentive Program under the Older Americans Act. So we are proposing to use a portion of that carryover to fill in that gap in the funding. As I mentioned, the independent and transitional living services is really one of our largest service areas. And we'd like to increase the Department of Housing's allocation by a little under $1 million. And again, that is to replace ARPA dollars that we can use out of carryover because that funding is not replicable. And then the other services, which it is a specific category, we are proposing an increase by about $153,000, again, to support COLAs and the replacement of one-time funding that is not replicable. And that is the end of our presentation. And so we're happy to take any questions.
I like that, quick, succinct.
I know
All
that,
done.
Senator.
See if there are any comments or questions. You? Representative Nuccio?
Thank you, Madam Chair. So thank you, Commissioner. Quick question on I'm looking at the allocation plan and I see, we consistently have the carry forward, but my concern is in looking at your presentation here, we're talking a lot about one-time bonuses and COLAs that we're supporting with carryover funds. So how does that work when the carryover funds go away, right?
Yeah.
We all know some point we're going to stop talking about COVID funding because
That's
it's
right.
going to be gone.
Yes.
And then we're going to have to deal with it. But
Yes.
so knowing that the COVID funding is going away, why are we giving one-time bonuses and COLA funding based off of carryover of the federal money?
Well, COLA, I'm using that as a broader term. It really is money that is going to agencies that they can use for wage increases, and they can also use it for other, I'll call them staff-related expenses. So we know that health insurance goes up every year exponentially, and there might be workers' compensation insurance that goes up every year. And the community action agencies and the other community-based organizations that we support just don't have the resources to keep up with that. So we do have the money to do that for them now. They completely understand and recognize that we will not be able to do this forever, and that carry forward is very limited. But for the time that we can do it, that allows them to give it will give them at least a year, if not two, in order to find other resources to continue it. So we have never done that with the promise to them that it's something that's perpetual, but it certainly does provide some breathing room, particularly as we watch the increases in energy costs and housing and other things that are going up. And rental, a lot of our community-based organizations are on properties that they don't own. So they also have those rent increases. So as they're trying to manage budgets that have those kinds of pressures on them, to the extent that we can use some of our carry forward to help with wage and other staff-related costs, that's what they've asked us for. And so that's what we're responding to.
So I guess my concern with it is, I was just on the MAPOC call last week. And again, I know we say, right, I've heard every commissioner say, it's one time, they know it's going away, everybody recognizes it's going away, we know it's going away. And then I'm on calls where those same people who supposedly know it's going away are saying the state needs to fix this. I need $10 million because I got $10 million in COVID and now I don't have $10 million anymore. So the state needs to give me $10 million. So my concern is, again, like where we talk about transitioning, like, money for the things, like we're going to slowly transition it down, and that what is the final communication out to people that this is it, right? This is it. And I'm just concerned that, so if it's a COLA and it's not salary related, they know that there is a high likelihood that they're not going to get that money. So the one-time bonuses, we're saying that's cash to them, one-time bonuses, but the COLA is not COLA in the terms that we think of it. It's just additional funding, and they know that's it, right? This
That's
is
right.
the last one.
That's right. Yes. And you're absolutely right, Representative True. And it's a very difficult message to deliver, particularly to community-based organizations that are already struggling under their budgets. But to the extent that we do have even limited or even time-limited resources to provide a little bit of relief to their budgets, and this is what they're asking for, And they really are essential in delivering the services that we have. If we can do this, then we are. It is always a struggle. They will always come back and say that it needs to be perpetual. We understand it, and I think we accept that risk, but
I have
also
dreams
understand-
about people asking me
I
for
do.
money.
I
They're
do.
more nightmares,
I
but-
do. They're not dreams people
I know.
actually come and ask all the time. So it's an important part of my reality. And I appreciate having those conversations with them because having been a provider myself at one point, I certainly understand the struggle. I do. But I also understand from the seat in which I sit now that the state has fiscal constraints as well. So this is a way in which we can try to strike that balance to the extent we still have the resources to do that.
Okay, thank you very much.
Senator Gordon.
Thank you, Madam Chair, and thank you for the presentation.
You're welcome.
I just have a quick question when we're talking about the protective services for adults. And certainly when I look at the numbers that you're citing here, I guess this is in 2023, as far as the number of adults who needed help with regards to protective support to mitigate abuse. It's sad there's even one case that you have to intervene, let alone the number that you are. But I noticed that, and I just want to understand the change in the number for what you're proposing for fiscal year 2025 has gone up. Is that because it's just a reallocation of money or any carryover, or it's actual real dollars to continue to service all the people who need servicing and or whatever additional staff might be needed? I'm just trying to get a little
Yes.
better understanding of that increase
Yeah.
as far as where that stands.
So Cassie, do you mind? Yes, we anticipated this question and Cassie's here, so thank you.
I'm glad I asked it.
Okay. So good afternoon, everybody. My name is Cassandra Norfleet Johnson. I'm here from the Department of Social Services. So what you're noticing as an increase is really about the timing of billing. We've done some really improved efforts of what we believe tied to bills being submitted and our ability to make timely payments associated with that. So it may look like on paper it's actually an increase, but in actuality, it is still we're going to be paying those older bills and just getting caught up in that instance.
Well, thank you. That's very, very helpful for me to understand. It certainly sounds like there's a continued need and unfortunately no lack of need moving forward. So that's helpful to understand how that is with regards to the funding. Thank you.
Representative Dathan.
Thank you very much, Madam Chair, and thank you, Commissioner, and thank you to your team for always being here. One of the things that you mentioned was about the rate increase as using these federal funds to support that. As you well know, we talked a lot about the Medicaid rate study earlier this year. And one of the concerning things that came out of that study was that we were about 62% of Connecticut compared to 5 state averages. I'm hearing from mental health providers in my community that it is hard to service the folks that need to be serviced with rates so low. And so I'd like to understand with these block grants that is being utilized for the one-time funding to support rate increases, where does that get us to in relation to this study that we looked at earlier this year?
So thank you.
Excuse me, I just want to jump in
Yes.
because we want to talk about the block grant directly. So make sure that the question is directly related to the block
Well,
grant.
the block grant is supporting rate increases, was
Yeah,
what
but-
per the commissioner's statement. And I want to understand the amounts from the block grant that are going to support rate increases that are right now one time.
Go ahead.
Yes.
Answer the
great.
question. Thank you.
Thank you, Representative. So thank you, Representative Dathan, and I may have misspoken for that. I apologize. It's not rate increases. These are increases that are going to our community-based organizations for their COLAs. So they can use those resources for staff increases, for one-time bonuses, and for other staff-related costs. Those aren't at all related to the rate study or the need for increased dollars in mental health services. I don't think anyone disagrees with that, and I think you heard a lot of testimony about that when the rate study did come out, but there's not a relationship between those with respect to this grant.
So just for the avoidance of doubt, the block funding that is going towards supporting our providers is for them to use at their discretion on how they support these services within the community. Is that what you're saying?
Yes, it's primarily to help, the majority of the money is to figure out, well, let me separate it. So the dollars themselves from the block grant are not, so let me separate it from the carry forward, because I think I'm even confusing myself right now. So we're talking about the carry forward, and the carry forward is what is going to be used by the community-based organizations to essentially shore up their staffing, and they have discretion as to how they use that. With respect to the block grants themselves, there are 11 categories in which they use this money for those services. And it is not necessarily up to their discretion. There are a number of federal rules and regulations that determine how it's used. But those particular increases are directly related to an increase in need in those particular areas, which is why we have the 11 versus there are 29 of them. But these are really the 11 that we've focused on, and where particularly our community action agencies. And we do have a couple, or at least one legal services organization that we fund to do the work in these areas.
Got it. Thank you very
You're
much. Well, I
welcome.
look forward to next session talking about Medicaid rates for behavioral health services.
Good.
Thank you, Madam Chair.
We can talk about next session and everybody can vote for a budget that includes another $1 billion. So thank you. Up next is Representative McCarty.
Thank you, Madam Chair, and welcome, Commissioner and your team. Could you just explain to me, for a little more clarity, the independent living and transition services? I know DCF worked with the emergency housing piece. Is that correct? And the Department of Housing had another portion of it. Can you just explain? It's a little bit unclear to me what percentage goes to DSS for those particular services.
Oh,
Cassie Williams,
Thank
if you
you.
don't mind.
so yeah, great question. It's one that we talk about often, tied to how we allocate money. So DSS is getting the smallest portion possible. So if you look at the block grant now on page 17 of that block grant, we have DSS is only getting 75,000 of that total dollar amount. DOH, Department of Housing, to support their emergency shelters and their transitional living programs, if you will, is getting about 7.4, and DEMIS is only getting 157,000. So the largest portion of these resources are really going to support the coordinated access system tied to emergency shelters and transitional living programs.
That helps me very much. Thank you. Thank you for that clarity.
Representative Case.
Thank you, Madam Chair. Good afternoon, Commissioner. So just looking through this, and I know we worked hard on this in Human Services, the home-based, the meals, home delivered meals.
Yeah.
Is that money and through this block grant that's going to be added on and going to Meals on Wheels programs or other programs through you?
Yes, it will go to other programs. Any home meal delivery services, this will help fund that.
But so through you, there is a set number within the budget that we increased in order for this to happen? Is this on top of what we did?
This includes that. So it's not on top of it. So we have the block grant, and we have state dollars. So we have our federal dollars that we put together with our state dollars. So I guess technically you could say that's on top of it, because it's a pool that we put together between the federal and the state to fund the home delivered meals program.
So you're looking at expenditure of 2024 of 1.4 million, and this is 2025 going up to 1.6.
Yes.
And I guess a lot of the questions is this block grant going to continue to go on? So is the 1.6 going to be sustainable in our budget, or is it going to be looked upon to keep the 1.6 so that we have this block grant also?
So the block grant has been the same. The federal block grant has been the same at least since 2021. So we're not anticipating any increases. So if there are any increases, it will have to be on the state side. But the combination of funding that you just described will remain the same in terms of its proportionality, because we really don't anticipate any increase in the block grant on the federal side.
Okay, and I guess we'll look at that closer when we come down to budget, because I'm just seeing
Yes.
an increase here. I want to make sure that we can sustain it, because this is something that's growing within our
Yes.
communities, the home meal deliveries, along with a lot of other things that DSS handles, that I don't know how you keep your eyes on everything that's going out the door, but
We
these
try.
small grants here are just a teeny tiny part of what DSS does, and we need to watch every penny that goes out the door and make sure that we know where it's going.
Yes,
Thank you.
thank you.
Any other comments or questions? Seeing none. Commissioner, you're all set. I'm gonna close the public hearing for these people, but we have one person up from the public. We have 3 minutes. Rhonda Evans, the Executive Director for the Connecticut Association for Community Action. Did you have more? I'm sorry. Oh, okay. I'm sorry, Rhonda, sit down for a minute.
I apologize. All right, let me just read it verbatim because it is important. All right, we would like to note that there is a technical error on page 5, section B 5, target population on the allocation plan. The allocation plan incorrectly identifies the service category for fatherhood as case management, but the category should have been stated as employment services. So we just
So,
wanted to make sure that was on.
Madam Administrator, do we need to say that when we are voting on this, please?
No, we do not. Now that the commissioner has placed that on the record, Madam Chair, we're all set. It covers everyone's bases.
Does anybody have any questions on what she just said? Can you just repeat that, please?
Okay. It's mislabeled. That was really the problem. Yeah.
Page 5?
Yes. It's on page 5, section B5, the target population on the allocation plan. So it incorrectly identifies a service category for the fatherhood initiative as case management, but it really should be employment services. So it just provides more specificity. Case management is sort of a larger category, but that particular category is specifically for employment services under the fatherhood initiative.
Okay, does anybody have any questions? Representative Walker?
I just think that you're talking from the actual packet of the, we're looking, we're thumbing through the OFA report. It's not in the OFA.
No, it's
but
in,
this is
it's in the actual
thank you.
allocation plan.
I just wanted to
Yes,
clarify.
It's a
everybody.
mislabeling on our part. We didn't want it to be misleading.
Yeah, everybody over here is looking for it on
I'm so
page 5
sorry.
and OFA.
Yeah, no,
We didn't
sorry.
see
It's
it.
in the actual allocation.
We
plan
got it. We're
itself.
good.
All right,
Thank you.
Thank you very much.
So Madam Chair, it's merely a typographical error and that's how we're treating it.
Okay, great. Anybody have any questions about that? Commissioner, you're all set. Thank you. Rhonda, you're up.
Good afternoon, distinguished chairpersons, vice chairs, ranking members, and members of the committee. I'm Rhonda Evans. I'm the executive director of the Connecticut Association for Community Action, also known as CAFCA. And thank you for holding this public hearing on the federal fiscal year 25 social services block grant allocation plan. As you may know, CAFCA is the state agency that works with Connecticut's 9 community action agencies, and we are federally and state designated anti-poverty agencies serving over 200,000 low-income people in each of the 169 cities and towns in Connecticut. And we're pleased to be here to support the Department of Social Services 2025 SSBG allocation plan. For nearly a decade, CAFCA has successfully operated the SSBG case management program in partnership with DSS and the community action agencies statewide. This program helps Connecticut's most vulnerable adults and families remain housed, gain employment, stay fed, receive treatment, access critical basic needs services, and learn valuable money management and life skills. From October 2023 through June 30th of 2024, the CAAs helped approximately 3,400 eligible individuals receive more than 13,000 different services, but also achieve a variety of impactful outcomes that are partially detailed in the full testimony that was provided. SSBG case managers work with vulnerable or at-risk customers and utilize a holistic approach to service delivery, beginning with the full assessment of their needs in areas like housing, employment, education, health, and more. And then they work with them to create a comprehensive, goal-oriented service plan with a realistic path towards self-sufficiency. The Community Action Network looks forward to continue to provide SSBG case management services to vulnerable or at-risk individuals and families in Connecticut in the coming year. And I'd like to thank Commissioner Barton Reeves and her team, as well as members of the Assembly, for continuing to support the critical work of community action and what we do to empower people in need and improve communities across Connecticut. Thank you so much for your time.
Thank you very much. Appreciate it. Have a nice night.
Thank you. You too.
Okay, we're going to end the public hearing and get ready for the committee meeting. Remember, votes will not be left open. Votes will not be left open. So please contact all the people within your respective committees and tell them they have to come online now, because votes will not be left open as we address the issues. So we're going. Yes, I think she's all set on it. She's online. She came online a long time ago. She had a 2 o'clock meeting. Yep. By the time we start, it'll be 5 minutes. Everybody's got to go contact everybody. Yeah, see, he has to go first. He wants to get going. He's got to go someplace. He's public health.
5 minutes.
So, huh? Oh. God. Are you going to be running public health? Yes.
You're talking to yourself.
We'll call the meeting.
Yeah.
You got that?
Yeah, I have.
Wait a minute, because somebody needs help. I know that. I said that.
But she said she wanted 5 minutes. Okay. Another 3 minutes and we'll have.
Just another 5 minutes. We just started at 41.
I'm looking at that. Look at what we're doing.
Julie Kushner, she's right there in line.
Can you hear me?
Yep, we're waiting for 5 minutes.
Okay,
Are you all set?
I am.
Thank you. Senator Anwar.
Thank you, Madam Chair. Good afternoon, everyone. At this time, I will convene the Public Health Committee meeting. We will entertain a motion to approve the following fiscal year 25 block grants allocation plans. One is maternal and child health services. Second is preventive health and health services. Third is substance abuse prevention, treatment, and recovery services. And the fourth is community mental health services. Is
So
there
moved. Second.
moved by Senator Summers and seconded by
Second. Rep. McCarthy Vahey.
Representative McCarthy Vahey is seconded. And at this time, Mr. Clerk, can we do a roll call vote, please?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
Rep. McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Representative Parker, Senator Summers,
Senator Summers votes yes.
Representative Claire Desditria,
Representative Claire Desditria votes yes.
Representative Belton, Representative Berger Gervalo,
Representative,
Berger Gervalo votes yes.
sorry, just want to clarify, Representative Belton.
This is Representative Belton. I'm here and I'm on the road and I was trying to take my camera off and I can't do that right now. I'm still trying.
I'll go back home. Senator Cabrera, Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative DiCaprio,
Representative DiCaprio votes yes.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Denning, Representative Elliott, Representative Jenga, Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Good afternoon, Mr. Clerk. Senator Gordon votes yes.
thank you. Representative Cavros DeGraw,
Representative Cavros DeGraw votes yes. Thank you.
Representative Kit,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Lynn, Representative
Sorry, did you say Representative Mara?
yeah,
Okay, Representative Mara votes yes.
or Representative McCarty,
Representative McCarty votes yes.
Representative Palm, Representative Perillo, Representative Rader, Senator Rahman,
Senator Rahman votes yes.
Senator Rahman, we need to see you.
You're going to be happy to see me. I'm in the hospital. Hold. Senator Rahman votes yes.
All right, you're good. Get better. Representative Reddington Hughes,
Are you asking me? I'm sorry, I didn't hear that.
oh, sorry, Reddington Hughes,
Oh, not Hughes. Okay.
Representative Ryan,
Votes yes.
okay.
Representative Ryan.
Senator Slap, Representative Steinberg,
Representative Steinberg votes yes.
Representative Terziak, Representative Wielander,
Representative Wielander votes yes.
Representative Zupkis, and then I'll go through again for people I missed. Representative Parker, Representative Belton,
Belton votes yes.
got you. Senator Cabrera, Representative Dauphiné, Representative Denning, Representative Elliott, Representative Jenga, Representative Linehan, Representative Palm, Representative Perillo, Representative Rader, Representative Reddington Hughes, Senator Slap, Representative Terziak, and Representative Zupkis. Thank you.
Mr. Clerk, just want to check if somebody showed up just now, and we do not see anybody new showing up on the camera. Mr. Clerk, can you announce a tally, please?
We have 23 voting yay, no voting nay. We have 0 abstaining. We have 14 absent not voting.
Thank you so much. Public Health Committee will be in recess. Thank you, Madam Chair.
Senator Lesser.
Yes. Madam Chair, I'd like to convene the meeting of the Human Services Committee for today. And with that, I'd like to ask for a motion to approve the following 2 block grant allocation plans: Community Mental Health Services and the Social Services Block Grant.
So moved.
So moved by Santiago. Second.
Motion made by Motion made by Representative Santiago, seconded by Representative Gilchrist.
Okay.
Is there any discussion? Seeing none, I'd ask that the clerk please call the roll.
Senator Lesser,
Senator Lester in the affirmative.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Seminara, I'll come back. Representative Case, Senator Gaston,
Senator Gaston votes yes.
Representative Dathan, Senator Marr,
Senator Marr votes yes.
Representative Butler,
Representative Butler votes yes.
Representative Comey,
Representative Comey votes yes.
Representative Cook.
Representative Cook votes yes.
One more time for me, please.
Representative Cook votes yes.
Thank you. Representative Fortier,
Representative Fortier votes yes.
Representative Heffernan,
Representative Heffernan votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Kit.
Representative Kit votes yes.
One more time for me, please.
Representative Kit votes yes.
Thank you. Representative Leeper,
Representative Leeper votes yes.
Representative Santiago,
Santiago votes yes.
Representative Buckby,
Buckby votes yes.
Representative Ferraro, Representative Mastro Francesco,
Representative Mastro Francesco votes yes.
Representative Pizzuto,
Representative Pizzuto votes yes.
Representative Paletta. Are there any members of the Human Services Committee that have not yet casted their vote would like to do so now? Senator Seminara, thank you, Mr. Chair.
Thank you. And when the clerk is ready, please announce the tally.
Total number of voting 19, those voting nay 19, those voting nay 0, those abstaining 0, those absent not voting 3. Thank you.
Motion passes. At this point, I'd like to recess the meeting of the Human Services Committee.
Thank you, Senator Lesser. I will now call the Appropriations Committee to order. Is there a motion to approve the following FFY 25 block grant allocation plans? Maternal and
Move.
health services, preventive health and health services, substance abuse prevention, treatment and recovery services, community mental health services, and social services. Is there a motion?
So second, Senator Anwar.
Moved by Representative Porter, seconded by Senator Anwar. Is there any discussion? Seeing no discussion, Madam Administrator, could you call the roll, please?
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker, Senator Hartley, Representative Exum,
Representative Exum votes yes.
Representative Paris,
Representative Paris votes yes.
Senator Berthel.
Good afternoon, Madam Administrator. Senator Berthel votes in the affirmative.
Thank you, sir. Good afternoon. Representative Nuccio. Senator Anwar,
Senator Anwar votes yes.
Representative Baker,
Representative Baker votes yes.
Representative Belinsky, Representative Callahan,
Representative Callahan votes yes.
Representative Candelaria, Representative Chaleski,
Representative Chaleski votes yes.
Representative Curry,
Representative Curry votes yes.
Representative Dathan,
Representative Dathan votes yes.
Representative DiCaprio,
Representative DiCaprio? Representative Delaney?
Representative Delaney votes yes.
Representative Dungy? Representative Dillon?
Yes.
Representative Felipe?
Representative Felipe votes yes.
Senator Flexer?
Senator Flexer votes yes.
There you are. Thank you. Representative Fonsello?
Representative Fonsello votes yes.
Representative Garabay?
Representative Garabay votes yes.
Representative Gibson?
Representative Gibson votes yes.
Representative Gilchrist?
Representative Gilchrist votes yes.
Senator Gordon?
Good afternoon. Senator Gordon votes yes.
Thank you, sir. Representative Gonzalez? Representative Haddad?
Representative Haddad votes yes.
Representative Hall? Representative Harrison?
Representative Harrison votes yes.
Representative Hoxa? Representative Johnson?
Representative Johnson votes yes.
Representative Khanna?
Representative Khanna votes yes.
Representative Kennedy?
Kennedy votes yes.
One more time for me, ma'am.
Kennedy votes yes.
Thank you.
Thank you.
Senator Kushner?
Senator Kushner votes yes.
Thank you, ma'am.
Thank you.
Senator Lesser?
Senator Lesser, yes.
One more time, sir.
Senator Lesser, yes.
Thank you. I'm gonna take a pause for a moment. Representative Hoxa, I see that you're on. How would you like to vote, sir?
Hi, Rep. Hoxa votes yes.
Thank you, sir. Senator Marks?
Marks votes yes.
Representative McCarty?
Representative McCarty votes yes.
Senator McCrory? Representative Nolan?
Representative Nolan in the affirmative.
Representative Porter? Representative Osborne?
Representative Osborne votes yes.
Representative Reyes? Representative Rosario?
Representative Rosario in the affirmative.
Representative Rutigliano? Representative Ryan?
Representative Ryan votes yes.
Representative Sanchez? Senator Slapp?
Senator Slapp votes yes.
Representative Sims?
Representative Sims votes in the affirmative.
Senator Summers? Senator Summers? Representative Tersiak?
Senator Summers votes yes.
Could you turn your camera on for me, please, ma'am?
Sorry. Senator Summers votes yes.
Thank you. Representative Tersiak? Senator Winfield?
Senator Winfield in the affirmative.
Representative Zawistowski? Are there any members of the Appropriations Committee who have not yet cast their votes who would like to do so at this time?
Representative.
Let's go alphabetically. Representative Candelaria?
Representative Candelaria votes in the affirmative.
Thank you, sir. Representative DiCaprio?
Representative DiCaprio is now unmuted and votes yes.
Thank you, sir.
Thank you.
Anyone else?
You got my vote, Representative Gonzalez?
Hi, Representative Gonzalez. How would you like to vote, ma'am?
Yes.
Thank you.
Thank you.
Madam Administrator, when you're ready, could you announce the tally, please? Julie? Oh, she voted. No, not in this one. Julie Kushner, she voted.
Oh, no, Joan.
Oh, Joan. I agree. All the senators voted in Human Services. Most voted in Public Health. Two. I was waiting for Doug to come. I know, he was fine, he was good. He must be proud. Oh, he's in school.
Total number voting 44, those voting yea 44, those voting nay 0, those abstaining 0, those absent not voting 9.
Thank you, Madam Administrator. I adjourn this meeting.
Thank you. This is Senator Saud Anwar. We are going to reconvene the Public Health Committee meeting, and I will ask for a motion to adjourn.
So
Is there-
moved.
And is there a second? All those in favor, aye. All right, we stand adjourned from Public Health. Thank you, Madam Chair.
I'd like to call back to order the meeting of the Services Committee, and I'll entertain a motion to adjourn.
So moved.
Motion, Representative Cook. Is there a second?
Second, Rep. Pizzuto.
Second, Representative Pizzuto. All in favor, aye. Aye, we're adjourned.
Madam Administrator, do we have any other business coming before us at any time in the next little bit of time?
We don't want to talk about it anymore. I'm going out on a limb and saying no.
Okay,
today.
thank you. Thank you. Everybody have a nice day.
Bye. Bye-bye.